Good morning. Hi, good morning. Good morning. Amit, good morning. So, welcome to this marathon series, INI marathon series of anatomy. Hi, Sanvi. Good morning. So, we'll discuss this. We'll discuss some important topics. ठीक है ये important topics discuss करने के बाद make it a point to give the grand test which is going on PW Meded app. ठीक है PW Meded app पे grand test भी चल रहा है. So once this session is over, make it a point to give the grand test. हाँ मिनिमम 2 घंटे तो लगेंगे, 2 घंटे के ऊपर ही होगा ये. ठीक है सनवी. हाय गौरव. चलो लेट अस स्टार्ट. तो कुछ विजुअल्स हैं, कुछ टॉपिक्स हैं. Let it be an interactive session. So you talk, I also talk. So let it be an interactive session. Okay. So starting with the first slide, have a look at this. Chalo, identify this clinical condition. Identify this clinical condition, the first one. You can answer, you can guess, that's okay. अगर यहाँ पे गलती भी हो जाता है, that's fine. So we'll make it a point to improve it. Chalo, so what is this first clinical condition? The wrist has gone down. That's a wrist drop. Right. So this is wrist drop, and wrist drop occurs due to paralysis of which muscle? Very good. Which is the muscle which causes extension at the wrist? Answer this. The muscle, very good. The muscle causing extension at the wrist is ECRL, extensor carpi radialis longus, right? And this extensor carpi radialis longus को कौन supply करता है? Radial nerve. Very good. So this is the radial nerve. Radial nerve injury would give rise to a wrist drop. अब एक दूसरा भी स्लाइड आता है जिसमें तो फिंगर्स आर डाउन, फिंगर्स ऐसे ड्रॉप होता है. सो दैट इज फिंगर ड्रॉप, एंड फिंगर ड्रॉप इज ड्यू टू इंजरी टू विच मसल? बोल सकते हो फिंगर ड्रॉप इज ड्यू टू इंजरी टू विच मसल? ये wrist ड्रॉप है. दूसरा होता है फिंगर ड्रॉप. हाँ, सो बोल सकते हो फिंगर ड्रॉप इज ड्यू टू इंजरी टू विच मसल? यस यस, वेरी गुड गौरव, सानवी, वेरी गुड मयूर. हाँ, बहुत अच्छा आंसर कर रहे हो अमित, वेरी गुड. चलो, finger drop is due to paralysis of, yes, extensor digitorum. This is extensor digitorum, and this extensor digitorum, ये तो wrist drop है. This is wrist drop. So wrist drop is due to injury to ECRL, paralysis of ECRL supplied by radial nerve. Wrist finger drop is due to paralysis of extensor digitorum, and this extensor digitorum is supplied by which nerve? बोल सकते हो extensor digitorum is supplied by which nerve? That's a posterior introitious nerve. Posterior introitious nerve. The posterior introitious nerve अगर इंजरी होती है तो we get a finger drop. Finger drop. वैसे radial nerve इंजरी हो गया तो posterior introitious nerve is also injured. You get a wrist drop as well as finger drop. अगर radial nerve इंजरी होती है तो posterior introitious nerve is a branch of radial nerve, so we get a wrist drop as well as a finger drop. But only अगर posterior introitious nerve की इंजरी होती है, so we get only a finger drop. Okay, pure lesions of posterior introitious nerve में क्या मिलेगा? Finger drop. उसमें wrist drop नहीं होगा. Wrist drop is not going to be there in lesions of PIN, posterior introitious nerve. That's a deep branch of a radial nerve. And this posterior introitious nerve pierces a muscle. बोल सकते हो which muscle does the posterior introitious nerve pierce? The supinator. Yes, posterior introitious nerve किसे pierce करता है? Supinator muscle को pierce करता है. That's an MCQ for you. हाँ, तो बहुत सारे MCQs discuss करेंगे in this course of anatomy. Fine, ठीक है. So this is clear. चलो, identify this clinical condition. What is this clinical condition? Yeah, have a look at this. Radial nerve above the elbow supplies the ECRL. Yes, that's on the lateral aspect of the arm. Lateral aspect of the arm को ECRL को supply करता है. Very good. Coming to the second slide, identify this. This is a flattening of the thenar eminence. बोल सकते हो? Who's that? There's a flattening of the thenar eminence. What is this clinical condition known as? Clinical condition. This is the carpal tunnel syndrome. Okay, that's a carpal tunnel syndrome. And in this carpal tunnel syndrome, there's a flattening. I mean, there's a paralysis of the muscles of the thenar eminence. So flattening of the thenar eminence plus loss of sensations of the skin on this 3.5 fingers. 3.5 fingers के skin का sensations चले जाएंगे. Can anyone tell me who supplies the skin over the thenar eminence? The skin over the thenar eminence is supplied by the palmar cutaneous branch of medial nerve. The skin over the thenar eminence is supplied by the palmar cutaneous branch of medial nerve. ठीक है, and ये flexor retinaculum के ऊपर से जाती है. So अगर carpal tunnel syndrome होता है, there's a loss of sensations of this 3.5 fingers, but the sensations of the skin over the thenar eminence is intact. Intact, समझ में आ रही है? अगर carpal tunnel syndrome होता है, that means the medial nerve is compressed in the carpal tunnel. 5 muscles are paralyzed, 3 muscles of thenar eminence, 2 lumbricals paralysis हो गए. There'll be a loss of sensations of this 3.5 fingers, but the sensations of the skin over the thenar eminence ये intact होंगे. Why? Because this nerve नाम है palmar cutaneous branch of medial nerve. ये flexor retinaculum के ऊपर से जाती है. It goes above the flexor retinaculum and supplies the skin over the thenar eminence. Right? If the medial nerve is injured in the forearm or in the arm, तो ये भी sensations जाएंगे and ये भी sensations चले जाएंगे. Understanding this, students? Yes. Structures passing above the flexor retinaculum. You have to know that structures passing above the flexor retinaculum. बोल दो. Structures passing above the flexor retinaculum. Anyone? Anyone? One is ulnar nerve and artery. Ulnar nerve and artery. Second is the palmar cutaneous branch of ulnar nerve. Palmar cutaneous branch of ulnar nerve. Third is palmaris longus. Palmaris longus का tendon. ठीक है. Fourth is palmar cutaneous branch of medial nerve. Palmar cutaneous branch of medial nerve, and fifth is the superficial palmar branch of radial artery. Superficial palmar branch of radial artery. So ये है structures passing above the flexor retinaculum. This is very important. याद रखना, structures passing above the flexor retinaculum sequence होगा medial to lateral sequence. सबसे medial is ulnar nerve and artery, then is the palmar cutaneous branch of ulnar nerve, then is the palmaris longus, then is the palmar cutaneous branch of medial nerve, and सबसे lateral होगा superficial palmar branch of radial artery. Fine है Sanvi? Fine. So just remember this, and ये कुछ चीजें हैं which you have to know बच्चों. You should know this. हाँ, ये कहीं किसी भी तरह से आ सकता है, clinical question भी आ सकता है इसमें. हाँ. So person complains of loss of sensations over 3.5 fingers, but sensations over the thenar eminence intact है. मतलब the medial nerve is compressed in the carpal tunnel, and ये जो branch है palmar cutaneous branch of medial nerve, ये flexor retinaculum के ऊपर से जाके इसे supply करता है. Okay, fine, clear to all of you? Yes, coming to this, identify this clinical condition. Yes, look at that clinical condition. Bachcho, chalo, answer this. You should know this. Look at this shoulder and look at this shoulder. Any difference that you're seeing? कुछ difference लग रहा है? Any difference? Come on, students, answer. Any difference here? Any difference here? Come on, students, guess करो. अगर गलत है तो भी चलेगा, but guess, make mistakes here. So later it will be easy for you. What is this? ये difference क्या है? देखो इसमें यहाँ पे the shoulder contour, the shape of the shoulder is maintained. The shape of the shoulder is there. इसे बोलता है contour of the shoulder. Contour. Whereas यहाँ पे देखिए, यहाँ पे the shape of the shoulder. Look at this. The shape of the shoulder. हाँ, इसमें this is a flat shoulder. बच्चों ये है flat shoulder, and this flat shoulder there is a loss of rounded contour of the shoulder. Very good Sanjay. So इसे हम बोलते हैं flat shoulder. देखिए ना, ये flat shoulder है. You can see the tubercles of the humerus, है ना? Tubercles of humerus बहुत clear दिख रहे हैं. मतलब the deltoid is paralyzed. The deltoid is paralyzed. This is flat shoulder. This is due to damage to the axillary nerve. बच्चों clear है? Damage to the axillary nerve. The deltoid is paralyzed. ये है flat shoulder. याद रखना, flat shoulder is seen in lesions of paralysis of deltoid. Nerve कौन है? Axillary nerve. वैसे बच्चों बोल सकते हो axillary nerve supplies two muscles. Answer this. Axillary nerve supplies the deltoid, and which is the other muscle which the axillary nerve supplies? Come on, be quick. Answer. Axillary nerve supplies the deltoid and anything else? Teres minor. Yes, teres minor. Axillary nerve supplies the deltoid and teres minor, and it gives a cutaneous branch. Cutaneous branch का नाम क्या है? Upper lateral cutaneous nerve of arm. Upper lateral cutaneous nerve of arm. That's a cutaneous branch. It supplies the skin on the upper lateral aspect of the arm. Very good, Gaurav. So actually, दो muscles को supply करती है. Deltoid teres minor वो एक cutaneous branch देता है. That is the upper lateral cutaneous nerve of the arm. And if there's a if there's an injury to this upper lateral cutaneous nerve arm, these sensations are lost. क्या बोलते हो? What do you call this as? इसे हम बोलते हैं regimen batch sign. Regimen batch sign. A very important thing, very important topic for INI-CET. बच्चों याद रखना, regimen batch sign is due to damage to the axillary nerve. Sensations over the upper lateral aspect of the arm is gone. ठीक है, very good. So ये है deltoid. Very nice. बहुत अच्छा आंसर कर रहे हो सब, बहुत अच्छा आंसर कर रहे हो. ठीक है. Now see this. What is this clinical condition? बोल सकते हो, what is this clinical condition? हाँ, very good अंकित, very good. ये clinical condition identify कर लो. Just see what is the difference here. यहाँ पे कुछ नहीं दिख रहा है, यहाँ पे something is very prominent. हाँ, what is that? easy है. Come on बच्चों, come on. Can you answer this? Something is very prominent here. The medial border of the scapula is prominent. This is winging of scapula. Winging of scapula is due to paralysis of two muscles. एक है serratus anterior, एक है trapezius. Serratus anterior paralyzed हो गया, winging होता है. Trapezius paralyzed हो गया, तो भी winging होता है. How do you differentiate between this? कैसे differentiate करोगे? Winging of scapula is due to So have a look at this. I'll just write this down. Winging of scapula at rest and on movement. मतलब अगर बंदा ऐसे ही बैठा है, the person is just sitting and there's a winging of scapula. So this is due to paralysis of trapezius. And when a person is performing a movement, अगर वो कोई movement कर रहा है, and then there's a winging of scapula. So this is due to paralysis of serratus anterior. याद रखना. So winging at rest, trapezius, and winging on attempting movement, that's serratus anterior. याद रखना. Fine. एक चीज बोल सकते हो, what is the nerve to serratus anterior? उसकी root value बोल सकते हो. Root value of nerve to serratus anterior. Come on, students, you can answer this. Yes, very good, Rushabh. What is the root value of the long thoracic nerve or the nerve of Bell or the nerve to serratus anterior? Come on, students, come on. The root value. कहाँ से आता है ये कौन से? If I tell you, then it will be very easy. चलो बोलो. Long thoracic nerve का root value बोल सकते हो. What is the root value of the long thoracic nerve? That's C5, C6, C7, root of the brachial plexus. C5, C6, C7, root of the brachial plexus. Very good. Okay, now coming to this spaces around the arm. ये spaces around the arm है. मैं एक slide draw करता हूँ आपके लिए. Spaces around the arm बहुत ज़्यादा important topic है ये. That's a scapula, बच्चों. This is the spine and the acromion process. That's the humerus. I'll just make this slide for you. वैसे बोल सकते हो, what is this muscle here? यहाँ पे कौन सा muscle है? What is this muscle? What is this muscle? And what is this muscle attached to the scapula? 1, 2, and 3. चलो, answer this. What are these muscles attached to the scapula? बच्चों, grand test जरूर दीजिए. Grand test which is going on PW Meded app. Grand test चल रहा है. आप वो attempt कर सकते हो. Okay, you'll get a good practice of answering the questions. So this is the scapula. That's the medial border of the scapula. Dorsal aspect है. ये कौन सा muscle है? Number 1, number 2, number 3. Yes, ऋषभ बोलो. So this number 1 is the levator scapulae. ये है rhomboidus minor, and this is the rhomboidus major. Fine. So levator scapulae, rhomboidus minor, rhomboidus major. Okay, we are interested in something else. What is this muscle? ये कौन सा muscle है? Which begins from the infraglenoid tubercle and goes to the humerus. And what is this muscle? What is this muscle and what is this muscle? चलो अगर ये क्लियर है ना तो ये सब विजुअल्स भी क्लियर हो जाते हैं, विजुअल्स भी क्लियर हो जाएंगे. चलो आंसर दिस. सो दिस इज teres minor, this is teres major, and this is the long head of triceps. Long head of triceps. Fine. Teres minor, teres major, long head of triceps. Fine. So बोलो what is this space? ये space का नाम बताओ. What is this space? What is this space? And what is this space? हाँ, so ये है upper triangular space, ये है lower triangular space, and ये है quadrangular space. बच्चों ये MCQs आते हैं. You get this as visuals also. Visuals भी आते हैं, MCQs भी आते हैं. So be very clear about this. Teres minor, teres major, long head of triceps. You get three spaces. This is the upper triangular space, the lower triangular space, and the quadrangular space. Quadrangular space आप बोल सकते हो what is this structure which comes to the upper triangular space? वो है circumflex scapular artery. Circumflex scapular artery. What is this artery which passes through the upper triangular space? हाँ, ये कौन है? Posterior circumflex humeral artery, and there's a nerve here. That's an axillary nerve. Axillary nerve and posterior circumflex humeral artery. Axillary nerve and posterior circumflex humeral artery. In the lower triangular space is the radial nerve and profunda brachii artery, and this is the circumflex scapular artery. Circumflex scapular artery. बच्चों clear है? So this can come in any form. Concept याद रखना. Understand the concept. Understand the basics. Questions can be framed in any way. कैसे भी क्वेश्चंस आ सकते हैं. बेसिक्स याद रखना. ये बेसिक्स है, राइट? ये कंसेप्ट्स है, इसे याद रखना. सो क्वाड्रेंगुलर स्पेस के कंटेंट्स क्या है बच्चों? एक्सिलरी नर्व एंड द पोस्टीरियर सर्कमफ्लेक्स ह्यूमरल आर्टरी. लोअर ट्रायंगुलर स्पेस के कंटेंट्स क्या है? रेडियल नर्व एंड द प्रोफंडा ब्रेकाई आर्टरी. एंड अपर ट्रायंगुलर स्पेस का कंटेंट है सर्कमफ्लेक्स स्कैपुलर आर्टरी. परफेक्ट है. इसके बाउंड्रीज भी देख लो. हाँ, बाउंड्रीज, द स्लाइड इज सेल्फ एक्सप्लेनेटरी. आप ये देखोगे, यू विल अंडरस्टैंड. ट्राइसेप्स के तीन हेड्स होते हैं. वन इज दिस लॉन्ग हेड ऑफ ट्राइसेप्स व्हिच अराइजेस फ्रॉम द इंफ्राग्लिनॉइड ट्यूबरकल. एक यहां से जो शुरू होता है, फ्रॉम हियर. व्हाट इज दिस हेड ऑफ ट्राइसेप्स? यहां से जो शुरू होता है, दिस इज द मीडियल हेड ऑफ ट्राइसेप्स. एंड इसके ऊपर से जो शुरू होता है, दैट्स अ लैटरल हेड ऑफ ट्राइसेप्स. रेडियल ग्रूव है, स्पाइरल ग्रूव है. स्पाइरल ग्रूव के नीचे कौन है? दिस इज द मीडियल हेड ऑफ ट्राइसेप्स. इसके ऊपर है, स्पाइरल ग्रूव के ऊपर इज द लैटरल हेड ऑफ ट्राइसेप्स. एंड दिस इज द लॉन्ग हेड ऑफ ट्राइसेप्स. ये बन गया ट्राइसेप्स. वैसे बाइसेप्स के भी दो हेड्स होते हैं. द लॉन्ग हेड ऑफ बाइसेप्स अराइजेस फ्रॉम हियर. व्हाट इज दिस? सुप्राग्लिनॉइड ट्यूबरकल. यहां से क्या शुरू होता है? लॉन्ग हेड ऑफ बाइसेप्स. द शॉर्ट हेड ऑफ बाइसेप्स अराइजेस फ्रॉम द कोरोकॉइड प्रोसेस ऑफ स्कैपुला. सिंपल. लॉन्ग हेड ऑफ बाइसेप्स, सुप्राग्लिनॉइड ट्यूबरकल ऑफ स्कैपुला. शॉर्ट हेड ऑफ बाइसेप्स, कोरोकॉइड प्रोसेस. याद रखना. ट्राइसेप्स तीन हेड्स है. लॉन्ग हेड, इंफ्राग्लिनॉइड ट्यूबरकल. लैटरल हेड above the spiral groove, medial head below the spiral groove. Simple. Rishabh, clear hai? I hope this is clear to all of you. Yes. Chalo. Identify this. What is this? बोल सकते हो what is this? Another very important topic है. बहुत important है. हमेशा पूछते हैं, visuals में पूछते हैं, boundaries पे MCQs आता है. What is this triangular structure? Any guesses? Come on, students, come on, you can answer this. Easy है. हाँ, अरे देखता हूँ. वेट पहले ये खत्म करते हैं, बाद में टाइम है तो विल डिस्कस दोस थिंग्स. ठीक है. एनाटॉमिकल स्नफ बॉक्स. यस, वेरी गुड. कैन यू टेल मी द बाउंड्रीज ऑफ द स्नफ बॉक्स? बाउंड्रीज ऑफ द स्नफ बॉक्स बोल सकते हो. देखो कैसे याद रखते हैं. आई विल मेक वन इजी स्लाइड फॉर यू. दैट्स द हेड ऑफ द रेडियस, नेक ऑफ द रेडियस, रेडियल tuberosity. दैट्स द शाफ्ट ऑफ द रेडियस, दैट्स द styloid process. ये है अल्ना, दैट्स styloid process of अल्ना. हाँ, ये पीछे से देख रहे हैं अपन. ये लुकिंग दिस फ्रॉम द डॉर्सल एस्पेक्ट. नाउ यू टेल मी व्हाट इज दिस मसल? ये जो मसल है, बिगिंस फ्रॉम द रेडियस एंड अल्ना. इसका नाम है abductor pollicis longus. abductor pollicis longus. दिस मसल बिगिंस फ्रॉम द रेडियस. इसका नाम है extensor pollicis brevis. right? So abductor pollicis longus and extensor pollicis brevis, they go together, दोनों साथ में जाते हैं, they form the lateral boundary of the anatomical snuff box. So lateral boundary of the snuff box is formed by the abductor pollicis longus and extensor pollicis brevis. Fine. The medial boundary is formed by extensor pollicis longus. ये आ गया, that's a medial boundary of the snuff box. बहुत simple है बच्चे, ये slide याद रखना, anatomical snuff box will be very clear to you, but ये बहुत ज़्यादा confusing होता है students के लिए, right? So I've made it very easy. Lateral boundary of the snuff box, abductor pollicis longus, extensor pollicis brevis, medial boundary is formed by extensor pollicis longus. The floor is formed by the styloid process and two bones, scaphoid and trapezium. Scaphoid and trapezium. Right? Content में कौन है? Radial artery. Content is the radial artery and the roof is formed by the cephalic vein and the superficial branch of radial nerve. Content is radial artery. याद रखना, content of snuff box क्या है? Radial artery and roof में क्या होता है? हाँ, cephalic vein and the superficial branch of radial nerve. Perfect. ऐसे है ना, फटाफट दो मिनट में you have to revise everything. Understood? Clear? So boundaries clear है. Boundaries पे बहुत confusion होता है, ये slide याद रखना. हाँ, this two muscles go laterally, ये बन गया lateral boundary. This is going to form the medial boundary of the snuff box. Floors is formed by styloid process, scaphoid and trapezium. Content is radial artery, roof में cephalic vein and the superficial branch of radial nerve. Yes, Vicky, very good. Clear? So that's the snuff box. ये याद रखना. So look, what is this boundary? That's a medial boundary. ये medial boundary है. And what is this boundary? That's a lateral boundary of the snuff box. So ये lateral boundary है, ये medial boundary of the snuff box है. Perfect. Okay. Coming to this. Okay, tell me, what is this? What is this area? That's a cubital fossa. That's a cubital fossa. ठीक है? That's a cubital fossa. And can anyone tell me the contents of the cubital fossa? Contents of cubital fossa from medial to lateral side. Yes, this is 1, this is 2, this is 3, and this is 4. Contents of cubital fossa. Anyone? Contents of cubital fossa from medial to lateral side is 1 is the median nerve, 2 is the brachial artery, 3 is the tendon of biceps, and 4th is the radial nerve. ठीक है? हाँ, that's okay. हाँ, contents of cubital fossa, इस पे भी MCQ आता है बच्चों, याद रखना. रेडियल नर्व, हाँ याद रखना, अल्ना नर्व इज नॉट अ कंटेंट ऑफ cubital fossa. हमेशा आता है, बहुत बार पूछता है, अल्ना नर्व ऑप्शन में होता है. अल्ना नर्व इज नॉट अ कंटेंट ऑफ cubital fossa. MBBS नहीं है, इट्स MBBR. It's MBBR. It's MBBR. It's median nerve, brachial artery, tendon of biceps, and the radial nerve. MBBR. ठीक है? Fine. Can anyone tell me the floor of cubital fossa is formed by what? Floor of cubital fossa किससे बनता है? The floor of cubital fossa is formed by, ये याद रखना, this comes in the MCQs. Floor is formed by the brachialis and supinator. The floor of cubital fossa is formed by the brachialis and the supinator. हाँ, superficial branch radial nerve बोल सकते हो, superficial branch of radial nerve भी बोल सकते हो. Some books mentioned radial nerve, some books mentioned superficial branch of radial nerve. Option देखना है and वैसे answer करना है, right? You have to see the options and you have to answer accordingly. अगर superficial branch of radial nerve दिया है तो that is the first answer. अगर radial nerve दिया है तो that's the second answer. Fine, it's a superficial branch. Yes. Clear to all of you? Okay, so that is about the cubital fossa. Yes, branches of axillary artery. Can anyone tell me the branches of axillary artery? Superficial branch is generally the first answer to be taken. Because क्या होता है ना, radial nerve comes on the lateral aspect, divides into two, superficial branch and deep branch. वो जो deep branch है ना, वो supinator को pierce करती है. So that is why superficial branch is generally taken as the content of cubital fossa. ठीक है? Fine. Okay. Now branches of axillary artery. Axillary artery is divided into 3 parts by a muscle. बोल सकते हो कौन है? Which is the muscle which divides the axillary into artery into 3 parts? That's the pectoralis minor. Pectoralis minor divides the axillary artery into 3 parts. So first part, second part, and third part. फर्स्ट पार्ट, सेकंड पार्ट एंड थर्ड पार्ट. फर्स्ट पार्ट का एक ब्रांच, सेकंड पार्ट के दो ब्रांचेस, थर्ड पार्ट के तीन ब्रांचेस. कम ऑन स्टूडेंट्स, कैन यू आंसर दिस? व्हाट इज द ब्रांच फ्रॉम द फर्स्ट पार्ट? फर्स्ट पार्ट की ब्रांचेस सुपीरियर thoracic आर्टरी. सेकंड पार्ट की ब्रांच है lateral thoracic and thoracoacromial. lateral thoracic and thoracoacromial. and third part के तीन branches है anterior circumflex humeral artery, posterior circumflex humeral artery and the subscapular. Anterior circumflex humeral, posterior circumflex humeral and the subscapular artery. Fine, just remember this branches of axillary artery. It is divided into three parts by pectoralis minor. First part का एक branch है superior thoracic, second part के दो branches है lateral thoracic and thoracoacromial, and third part के तीन branches है anterior circumflex humeral, posterior circumflex humeral and the subscapular. Tell me, which is the chief artery supplying the breast? वैसे breast को काफी सारे arteries supply करते हैं. There are many arteries which supply the breast. Yes. There are many arteries which supply the breast. Lateral thoracic, thoracoacromial, intercostal arteries. But which is the main artery which supplies the breast? The lateral thoracic artery. याद रखना, the chief artery supplying the breast is the lateral thoracic artery, and this artery is enlarged in females. याद रखिए, that's very important MCQ. Okay, so the chief artery supplying the breast is lateral thoracic. Can you tell me musculocutaneous nerve? Something about the musculocutaneous nerve. Chalo bachcho, this is how you should be able to answer. Musculocutaneous nerve is a branch of which cord of the brachial plexus? Musculocutaneous nerve is a branch of which cord of the brachial plexus? Any guesses? Yes. First year का batch will start, बच्चे. Wait. First year का batch शुरू हो जाएगा next month. नेक्स्ट मंथ से शुरू हो जाएगा. हैव पेशेंस. अभी इतना सब नीड दिया ना, थोड़ा रिलैक्स कर लो. We'll start this batch soon. Okay. Okay, come on students. Musculocutaneous nerve is a branch of the lateral cord. Very good. Root value बोल सकते हो. Root value of musculocutaneous nerve. Root value of musculocutaneous nerve is C5, C6, C7. Yes. What are the muscles supplied by musculocutaneous nerve? This is the biceps brachii, biceps, the brachialis and coracobrachialis. So muscle supplied by the musculocutaneous nerve is the biceps, the brachialis and the coracobrachialis, and then the musculocutaneous nerve continues as what? It continues as the lateral cutaneous nerve of forearm. It continues as ये muscle supply करने के बाद it continues as the lateral cutaneous nerve of forearm. Lateral cutaneous nerve forearm. ठीक है, ये क्या सप्लाई करेगा? The skin on the lateral aspect of the forearm. It supplies the skin on the lateral aspect of the forearm. बहुत बार clinical MCQ ऐसे भी आता है. A person comes to your OPD complaining of loss of sensations of the skin on the lateral aspect of forearm. The nerve involved is, answer is musculocutaneous nerve. Perfect है? Very good, Arish. So musculocutaneous nerve ऐसे quick है ना, short में सब याद रखना. MCQs can come in any way, right? So it's a branch of lateral cord. Root value is C5, C6, C7. Supplies the biceps, the brachialis and the coracobrachialis, and it continues as the lateral cutaneous nerve of forearm. Very good. Arm is axillary. हाँ Sanvi, ये forearm है, forearm. This is forearm. Axillary nerve हमने डिस्कस किया. Axillary nerve दो मसल्स को सप्लाई करता है. Deltoid teres minor cutaneous branch देता है. Upper lateral cutaneous nerve arm. We've seen that. हाँ हमने डिस्कस किया है axillary nerve का. Okay बच्चों, coming to the next set of the slides. Can you tell me something about the hamstring muscles? बोल सकते हो? Hamstring muscles बोल सकते हो? Which are the hamstring muscles? Hamstring मतलब they support the pelvis on the femur. Which are the hamstring muscles? Come on. चलो बोलो. Which are the hamstring muscles? Any guesses? Yes, Sanvi, Arish, Vicky, Tamil, Maran, Rishabh. Which are the hamstring muscles? Any guesses? Hamstring muscles is the muscles in the posterior compartment of the thigh. Posterior compartment of the thigh के जो muscles है, these are the hamstring muscles. इसमें क्या आता है? Semitendinosus, semimembranosus, biceps femoris, and adductor magnus. Okay, semitendinosus, semimembranosus, biceps femoris, and adductor magnus. These are the hamstring muscles. Can anyone tell me what is the nerve supply of all these muscles? The nerve supply of all these muscles is the tibial part of sciatic nerve. The nerve supply of all these muscles is tibial part of sciatic nerve. Tibial part of sciatic nerve. Tibial part of sciatic nerve. ठीक है? वैसे biceps femoris has got two heads, long head and short head. The long head is supplied by the tibial part of sciatic nerve. The short head of biceps is supplied by whom? Anyone? Come on. The short head of biceps femoris is supplied by the common peroneal part of sciatic nerve. Common peroneal part of sciatic nerve. So, short head of biceps femoris hamstring nahi hota. It's not a hamstring. Hamstring mein kaun aata hai? Semitendinosus, semimembranosus, long head of biceps femoris, and adductor magnus. The short head of biceps femoris is supplied by the common peroneal part of sciatic nerve. It is not a hamstring. Yaad rakhna. It's not a hamstring. Fine. Yes, very good. बाकी सबने आंसर किया है. Excellent. Very good. Gluteus maximus. बच्चों, this is a very important muscle. Can anyone tell me what is the action of gluteus maximus? Action. इसमें MCQs आते हैं. What is the action of gluteus maximus? हाँ, आप बैठे हो, you're sitting down and we stand up. We stand up from a sitting position. This is done by gluteus maximus. ये action क्या है? What is this action? We are standing up from a sitting position. This is extension at the hip joint. बहुत ज़्यादा important है. Extension at the hip joint is done by whom? The gluteus maximus. Excellent. Very good. Specialist. So gluteus maximus का action is extension at the hip joint. That's a main action. दूसरा action is abduction and lateral rotation. Abduction and lateral rotation at the hip joint. याद रखना, but the main action क्या है उसका? Extension at the hip joint. Flexion नहीं है, flexion नहीं है, knee flexion नहीं है बच्चे. Gluteus maximus acts on the hip joint and through the iliotibial tract it acts on knee joint. It causes extension at the knee joint. Gluteus maximus directly knee joint पे act नहीं करता है. Gluteus maximus is inserted into the iliotibial tract and this iliotibial tract causes extension at the knee joint. आप ऐसे बोल सकते हो gluteus maximus through the iliotibial tract does extension at the knee joint. Fine. So the main action of gluteus maximus is extension at hip joint, abduction and lateral rotation. What is the nerve supply of gluteus maximus? That's the inferior gluteal nerve. Inferior gluteal nerve. याद रखना बच्चों, बहुत important है, बहुत important है. The inferior gluteal nerve supplies the gluteus maximus. Fine. वैसे superior gluteal nerve क्या supply करती है? Superior gluteal nerve supplies. This has been asked many times. बहुत बार पूछा गया है. The superior gluteal nerve supplies three muscles. Come on, answer. Superior gluteal nerve supplies three muscles. Inferior gluteal nerve is supplying the gluteus maximus, बच्चे. Sanvi. Inferior gluteal nerve supplies the gluteus maximus. The superior gluteal nerve supplies what? Internal rotation नहीं करता बच्चे. It is external rotation, lateral rotation. It's external rotation. Gluteus maximus internal rotation नहीं करता. No. हाँ, ठीक है. हाँ. So what is the inferior gluteal nerve supply? The inferior gluteal nerve supplies the gluteus medius, gluteus minimus, and the tensor fascia lata. Tensor fascia lata. This is a very important MCQ. बहुत बार पूछा गया है INI-CET में. हाँ. So what is the inferior gluteal nerve supply? The superior gluteal nerve, not inferior gluteal nerve. The superior gluteal nerve. The superior gluteal nerve supplies the gluteus medius, the gluteus minimus, and the internal rotation में minimus का action बता. हाँ, very good. हाँ, excellent. Minimus का action is medial rotation. Yes, specialist. Yes. So superior gluteal nerve supplies the gluteus medius, minimus, and the tensor fascia lata. Perfect. व्हाट इज द मेन एक्शन ऑफ ग्लूटियस मीडियस एंड मिनिमस? हाँ ये बोल रहे थे क्या? हाँ स्पेशलिस्ट इसका आंसर बोल रहे थे. हाँ यस यस, सुपीरियर नॉट इंफीरियर. सॉरी सॉरी सॉरी. So gluteus medius, the main action is abduction. Abduction. Gluteus minimus का the main action is medial rotation at the hip joint. At the hip joint. ये याद रखना. So gluteus medius का main action is abduction. Minimus का main action is medial rotation at the hip joint. At the hip joint. Fine. So just remember that, huh? Gluteus maximus का action, medius and minimus का action. The third action of gluteus medius and minimus is they support the pelvis when one foot is off the ground. They support the pelvis when one foot is off the ground. मतलब if I'm standing on my right leg, right side का gluteus medius and minimus are going to support the pelvis on the left side. समझ में आ रहा है? I'm standing on my right leg. Suppose मैं right leg पे खड़ा हूँ, my left leg is off the ground, तो right side का gluteus medius and minimus are going to support the left side का pelvis. Left side के pelvis को support करता है. अगर right side का gluteus medius and minimus is paralyzed, the pelvis falls on the left side. This is what we call as Trendelenburg's sign. Trendelenburg's sign. यह है Trendelenburg's sign. ठीक है ना? So the action of gluteus medius and minimus is support the pelvis when one foot is off the ground. They support the pelvis when one foot is off the ground. Fine. Okay. Pelvifemoral muscles. ये बोल सकते हो which are the pelvifemoral muscles? Can anyone tell me which is the key muscle of the gluteal region? Key muscle. K-E-Y. Key muscle of gluteal region. Can anyone tell me? The key muscle of the gluteal region is piriformis. So key muscle of the gluteal region is piriformis. Piriformis. याद रखना, this is very important. Key muscle of the gluteal region क्या है? Piriformis. इसको key muscle क्यों बोलते हैं? The moment we get this muscle, you get everything in this region. Everything. So which are the pelvifemoral muscles? Pelvifemoral muscles is that group of muscles. कौन कौन है ये? So pelvifemoral muscles में the first muscle is piriformis. The next is superior gemellus. Next is obturator internus. The next is inferior gemellus. And the last one is quadratus femoris. Quadratus femoris. This is the list of pelvifemoral muscles. Why is the piriformis known as key muscle? Because see, if you get the key, you enter the room. वैसे if you get the piriformis, you get everything in this region. सब कुछ तो मिल जाता है ये region में. Because above the piriformis is the superior gluteal nerve and vessels. Below the piriformis, that's inferior gluteal nerves and vessels, sciatic nerve, the nerve to quadratus femoris, the pin structures, everything is below the piriformis. That is why piriformis is known as key muscle of the gluteal region. Fine है. So ये है pelvifemoral muscles and ये सबका action क्या है बच्चों? What is the action of all these muscles? All these muscles are going to cause lateral rotation at the hip joint. Lateral rotation at the hip joint. ठीक है? I'll just show you the slide. Okay, slide नहीं है यहाँ पे. Fine. This is clear. So just remember the pelvifemoral muscles. Very good. Great. Now one short as in a shorts. MCQ के short सही है. Tendon winding around the medial malleolus. Come on, that's a very important MCQ. बोल सकते हो. Which is the tendon which hooks around the medial malleolus? Medial malleolus आपको पता है ना? On the medial aspect of the leg. There's a tendon which as it turns around the medial malleolus. कौन है ये? What is the name of this tendon? Very important. Very important. Can anyone tell me? Very good, Sanvi. That's fine. Arish, देखता हूँ. I'll tell you. चलो बोलो. Which is the muscle which winds around the medial malleolus? That's the tibialis posterior. Medial malleolus को wind क्या करता है? That's the tibialis posterior. The muscle which winds around the medial malleolus is tibialis posterior. ये याद रखना बच्चे, ये विजुअल्स भी आता है, मतलब medial malleolus दिखाते हैं, and there's a tendon which goes around the medial malleolus, which hooks around the medial malleolus. याद रखना that's tibialis posterior. Tibialis posterior, anterior नहीं है बच्चे, anterior नहीं है. Anterior is in the anterior compartment. जो posterior compartment के muscles है ना, they go between the medial malleolus and the tendoachilles. Tendoachilles. Between the medial malleolus and tendoachilles is posterior compartment. Anterior नहीं होता है. अरे tibialis anterior तो ऐसे भी दिखता है. Look, just do one thing. Tibialis anterior कैसे देखोगे? You just dorsiflex the foot and invert the foot. आप dorsiflex करो foot को, invert करो तो एक tendon बहुत ज्यादा prominent दिखेगा. That's tibialis anterior. ये सब visuals में आते हैं. You dorsiflex the foot. आप अपने foot पे देखिए. Just look at your foot. Dorsiflex and medially rotate or invert the foot. One tendon becomes very prominent. That's tibialis anterior. That's how you remember it. So the tendon which winds around the medial malleolus is tibialis posterior, and the tendon which winds around the lateral malleolus is peroneus brevis. लॉन्गेस्ट नहीं है, लॉन्गेस्ट नहीं है, इट्स पेरोनियस ब्रेविस. यही गलती करते हैं सब, इट्स पेरोनियस ब्रेविस. फाइन. हाँ, सो टेंडन व्हिच वाइंड्स अराउंड द मीडियल malleolus tibialis posterior, lateral malleolus is peroneus brevis. हाँ, navicular tibialis posterior, chief insertion is on navicular tuberosity. Perfect, very good. Okay, chief insertion on navicular tuberosity. ये navicular bone है ना, navicular bone है, वहां पे एक tuberosity होती है. The main insertion on navicular tuberosity is tibialis posterior. ये याद रखना. So tibialis posterior winds around the medial malleolus and then goes and gets inserted mainly on the navicular tuberosity. Navicular tuberosity पे main insertion होता है tibialis posterior का. Groove below the cuboid bone. Groove below the cuboid bone is for the peroneus longus. याद रखना, these are all shorts. MCQ shorts बोलते हैं इसको. One word में MCQ short. ऐसा short मिल गया. ऐसे ना, वो इंजेक्शन लगाते हैं ना, one shot वैसे. These are MCQ shorts. This you have to know. So the groove below the cuboid is for peroneus longus. Peroneus longus. अब ये लेयर्स ऑफ सोल जरा याद रखना. लेयर्स ऑफ सोल कैसे याद रखोगे? आई टेल यू वन इजी वे टू रिमेंबर द लेयर्स ऑफ सोल. ये है ग्रेट टो एंड ये है लिटिल फिंगर, ग्रेट टो एंड लिटिल फिंगर. ठीक है. हाउ मेनी लेयर्स ऑफ द सोल्स आर देयर? 4 लेयर्स होते हैं सोल में. दिस इज फर्स्ट, सेकंड, थर्ड एंड फोर्थ लेयर. हाँ, बस ये याद रखना. द वे आई एम टेलिंग यू, बस ये याद रखना. एवरीथिंग will be very clear to you. Chalo, great. So 4 layers है soul में. Out of this, the first and the third layer is intrinsic. Intrinsic का मतलब they are in the foot. They begin from the bones of the foot. They get inserted into the bones of the foot. मतलब foot से शुरू होता है, foot में insert होते हैं. They're छोटे small muscles, and all these small muscles will end with brevis. याद रखना. brevis, छोटे muscles. So first and third layer में जो muscles होंगे, these are small muscles. These are the brevis. कैसे याद रखोगे इसको? Put an abductor here, and put a flexor in between. This is my patent है, ये मैंने बनाया. Abductor here, flexor in between. नाम बोल सकते हो, छोटा muscle है. Abductor. So this is abductor of the great toe, abductor hallucis brevis. Abductor of the little finger, नाम क्या होगा? Abductor digiti minimi brevis. Abductor hallucis brevis, abductor digiti minimi brevis, and बीच में एक flexor डाल दो. Flexor, what is this? This is the flexor digitorum brevis. Flexor digitorum brevis. So दो abductors के बीच में एक flexor, abductor hallucis brevis, abductor digiti minimi brevis, and the flexor digitorum brevis. Fine, that's a easy way to remember. अब third layer में take flexors on both the sides. Put a flexor here, and put an adductor in between. ऐसे याद रखना है. First layer में abductor, बीच में flexor. Third layer में flexor, बीच में adductor. Okay, इसका नाम कैसे लिखोगे? What would the name of this be? Flexor hallucis brevis. Small muscle है. Flexor digiti minimi brevis, and this is the adductor hallucis. Adductor pollicis की वजह से adductor hallucis. So abductor, flexor in between. Third layer में flexor, adductor in between. That's a very easy way to remember the layers of the soul. MCQs आते हैं बस कौन से layer में कौन सा muscle है. This is what you are supposed to remember. Which muscle is present in which layer of the soul. Perfect है, easy है, enjoying. Abductor बीच में flexor, third layer में flexor बीच में adductor. So these are muscles, small muscles in the soul. Now सेकेंड एंड फोर्थ लेयर में मसल्स कम फ्रॉम द लेग, बाहर से आते हैं मसल्स, प्लस दे आर इन द सोल. सो ये मिक्स लेयर है, इंट्रिंसिक एज वेल एज एक्सट्रिंसिक मसल्स, दोनों मसल इंट्रिंसिक एंड एक्सट्रिंसिक होता है सेकेंड एंड फोर्थ लेयर में. ओके, सो स्टार्टिंग विद द सेकेंड लेयर, राइट. नाउ व्हिच इज दिस मसल कमिंग फ्रॉम द लेग? फ्लेक्सर hallucis longus, flexor digitorum longus. ये लेग से आते हैं. फ्लेक्सर hallucis longus, flexor digitorum longus, ये लेग से आते हैं. These are extrinsic because ये बाहर से आ गए. And there are two intrinsic muscles. There are two intrinsic muscles here. Flexor digitorum longus is similar to profundus. Flexor digitorum profundus. And there are small worm-like muscles. Small worm-like muscles beginning from the tendon. नाम है lumbricals. And there's one more muscle in the sole. इसका नाम है flexor digitorum accessorius. Flexor digitorum accessorius. So second layer में ये दो intrinsic हैं, ये दो extrinsic है. अलग color से लिखा है because they are coming from outside. So who's the muscle coming from the leg? Flexor hallucis longus, flexor digitorum longus, and sole के अंदर जो muscle है that's lumbricals and flexor digitorum accessorius. Fine. And now coming to the last layer of the sole. The last layer of the sole, दो muscles बाहर से आ गए. एक है tibialis posterior, दूसरा है peroneus longus. ये बाहर से आ गए, लेग से आ गए. एंड सोल में होता है intraossei. That's the layers of the soul. That's it. बस ये याद रखना है आपको. Just have to remember this. That's very easy. That's a great toe. That's a little finger. That's how you remember. Understood? Simple है, बस ये याद रखना है आपको. मतलब फर्स्ट कैसे याद रखोगे? देखो, द फर्स्ट एंड थर्ड लेयर में इंट्रिंसिक मसल्स है, छोटे मसल्स है, सो दे एंड विद ब्रेविस. फर्स्ट लेयर कैसे याद रखोगे? abductor बीच में फ्लेक्सर, थर्ड लेयर में फ्लेक्सर बीच में adductor, एंड देन सेकंड लेयर में फ्लेक्सर hallucis longus, flexor digitorum longus, ये लेग से आगे extrinsic lumbricals and flexor digitorum accessories, and the last layer tibialis posterior, peroneus longus and the intraossei. Clear to all of you? बच्चों ये सब सुन लो एंड देन सॉल्व द एमसीक्यूज. हमारा ग्रैंड टेस्ट चल रहा है ऑन पीडब्ल्यू मेडेड ऐप, तो मेक इट अ पॉइंट टू गिव दैट ग्रैंड टेस्ट. तो वो रिवीजन हो जाएगा. ठीक है बच्चों, क्लियर है? ओके, फाइन. So now coming to the next. चलो, what is this clinical condition? Plantar nerve है ना बच्चे, medial and lateral plantar nerves है. Who's going to supply this muscles? ये muscles को कौन supply करता है? The medial and the lateral plantar nerves. Tibial nerve के दो branches है, medial and lateral plantar nerve, which are going to supply the muscles of the foot. Okay, what is this? ये बोल सकते हो, what is this clinical condition? ये हाँ, what is this? हाँ, excellent, very good. Foot drop, excellent बच्चे. Foot drop, and foot drop is due to injury to which nerve? Excellent. Injury to which nerve leads to foot drop? Your first answer is always the common peroneal nerve. Because common peroneal nerve अगर वो option में नहीं है, तो then take it as the deep peroneal nerve. Because deep peroneal nerve injuries are very less common. बहुत कम होते हैं deep peroneal nerve की injuries. Common peroneal nerve winds around the neck of the fibula. वहाँ पे injury बहुत common होता है. So injury to the common peroneal nerve, that's your first answer. So that's the foot drop. Excellent. Very good. दिस इज अ फ्लैट फुट, यानी इसको बोलते हैं फ्लैट फुट. फ्लैट फुट, when the arches and arches ऐसे flat हो जाते हैं, flat, this is what we call as pes planus or the flat foot. And there's a pes cavus जहाँ पे arches becomes exaggerated, the arches becomes exaggerated, so the foot becomes like a cave, pes cavus deformity. And when the foot becomes flat, that's a pes planus deformity, pes planus, pes cavus. Now when the person is walking on the tips, on the toes, उसे क्या बोलते हैं? Talus equinus, talus equinus. When a person is walking on the heel, इसे क्या बोलते हैं? Talus calcaneus. Walking on the heel is talus calcaneus. Walking on the toes is talus equinus. Then what is this? Talus varus. And what is this? Talus valgus. Walking on the inner border of the foot is valgus, outer border of the foot is varus. What is the most common deformity of the foot? Answer. Most common deformities of the foot. Talus equinovarus. Talus equinovarus. That's the commonest deformity. Talus equinovarus. ठीक है ना? ये पता होगा ना आपको? Equine is walking on the toes like a horse. Equine. Varus is walking on the outer border of the foot. That's varus. So talus equinovarus. That's the deformity. Very common deformity. Fine. Okay, fine, clear. Now coming to this, very good, very good, excellent. Chalo, just some MCQs. Bronchopulmonary segments, bronchopulmonary segments. Can you tell me what runs between the bronchopulmonary segments? इसके बीच में क्या होता है? Who runs between the bronchopulmonary segments like this? Like if I have to trace a segment, I just follow this structure. अगर मैं ये स्ट्रक्चर को फॉलो करता हूं, आई एम एबल टू डिफाइन वन ब्रोंकोपल्मोनरी सेगमेंट. व्हाट इज दैट स्ट्रक्चर व्हिच हेल्प्स अस टू डिफाइन वन ब्रोंकोपल्मोनरी सेगमेंट? कैन एनीवन टेल मी दिस? बहुत ज्यादा इंपॉर्टेंट है ये एमसीक्यू. हाँ बोलो. You become a cardiovascular thoracic surgeon in future and you are removing a segment. आप है ना, you're removing a segment of the lung, हाँ, disease segment of the lung. तो वो क्या स्ट्रक्चर है जो ब्रोंकोपल्मोनरी सेगमेंट्स के बीच में होता है, जिसे आप ट्रेस करोगे, यू विल बी एबल टू डिफाइन वन ब्रोंकोपल्मोनरी सेगमेंट. कम ऑन. बहुत इंपॉर्टेंट है. एनी गेसेस? फिशर्स नहीं बच्चे, फिशर्स तो है ही. Fissures is there, but there is something lying in the fissure. That's very important. Pulmonary veins. Yes, you got this right. The pulmonary veins. So who's between the bronchopulmonary segments? The pulmonary veins. As a cardiovascular thoracic surgeon, आप वो pulmonary veins को trace करोगे, you'll be able to define this segment, different bronchopulmonary segments. Now, each segment, हर एक segment का अपना artery होता है, artery, पल्मोनरी आर्टरी होता है, एंड एक टर्शियरी ब्रोंकस होता है. ओके, जस्ट रिमेंबर ईच ब्रोंकोपल्मोनरी सेगमेंट इज कोनिकल इन शेप, ऐसे कोन जैसे होता है. इट हैज गॉट इट्स ओन पल्मोनरी आर्टरी, इट हैज गॉट इट्स ओन टर्शियरी ब्रोंकस, बट pulmonary vein नहीं होता है. Pulmonary veins runs between the segments. The pulmonary vein is supposed to be intersegmental. That's the MCQ. Pulmonary veins are said to be intersegmental. That's a very important MCQ. Fine. एक दूसरा MCQ आता है, foreign body entering the nose. A child puts a foreign body in the nose. The foreign body directly goes where? Anyone? The foreign body goes where? A person, a small child playing, खेल रहा है वो, the child is playing, the child puts a foreign body in the nose, the foreign body directly goes in which segment? A very very important MCQ. बोल सकते हो? Foreign body entering the lungs, entering the nose, enters into which segment? Foreign body in the nose enters into the posterior basal segment of the right lung. ये याद रखना, posterior basal segment of the right lung. Posterior basal segment of the right lung. So foreign body put on the nose enters into the posterior basal segment of the right lung, because this posterior basal segment of the right lung is a continuation of the trachea. मतलब trachea continues as the right primary bronchus. The right primary bronchus continues as the secondary bronchus for the lower lobe, and this continues as the tertiary bronchus for the posterior basal segment. So अगर foreign body nose में जाता है, it directly goes to the posterior basal segment of the right lung. Very important. ठीक है. And दूसरा बोलो, aspiration pneumonia is common in aspiration pneumonia is common in which segment? Like a person is lying supine, the person vomits, or the bacha is feeding, the child is being fed, the child vomits, aspirates the vomiters. So when the child aspirates, the child gets an aspiration pneumonia. Aspiration pneumonia is common in apical segment of lower lobe. Apical segment of lower lobe. Apical segment of lower lobe, इसका दूसरा नाम है superior segment. Superior segment, ये याद रखना. Aspiration pneumonia is common in apical segment of the lower lobe. मतलब lower lobe का apical segment. Suprabasal. Yes, apical segment of the lower lobe, जिसका दूसरा नाम है superior segment. MCQ comes in any different way. ठीक है. So sub angle से you have to have a 360-degree view. 360-degree view. So MCQ asks in any different angle, you'll be able to answer, right? Perfect. ये याद रखना, a very important thing. चलो ये बोल सकते हो. Can anyone tell me this? This are the aortic arch arteries. Aortic arch arteries. हाँ, इसमें कुछ important चीजें देखते हैं अपन. Important चीजें. Aortic arch arteries. I'll just tell you the important things. Near the diaphragm नहीं, it's the most dependent part of the lung. मतलब कैसे है, when we lie supine, जब अपन supine lie करते हैं ना, सबसे lowest part of the lung क्या होता है? It's the most dependent part of the lung in supine position is apical segment of lower lobe. Right side है बच्चे, right side. Tamil Maran, right side. Okay, so when we lie supine, सबसे lowest part of the lung is the apical segment of lower lobe. जैसे when we lie supine, the lowest part of the peritoneal cavity is what? Answer this. When we lie supine, does any fluid in the peritoneal cavity enters into what? Answer this. Any fluid in the peritoneal cavity enters into that pouch, because वो सबसे lowest part है body का. What is that? Anyone? The lowest part of the body in supine position is the lowest part of the peritoneal cavity in supine position is the hepatorenal pouch of Morrison's pouch. So अगर कोई भी fluid है peritoneal cavity में, a person is lying supine, the fluid will gravitate into the hepatorenal pouch of Morrison's. Douglas नहीं है बच्चे, Vicky smooth specialist, Douglas नहीं है. Standing position, when a person is standing, if it's a female, it will then gravitate down. That is pouch of Douglas. अगर females में standing position में, the most dependent part of the peritoneal cavity is the pouch of Douglas, or the or the rectouterine pouch of Douglas. हाँ, and in males it is males में क्या होगा? It's the it's the rectovesical pouch. So males में होता है rectovesical pouch. एक मिनट, I'll just write this down. मैं लिखता हूँ. So in standing position, the most dependent part of the body in males and females, males में होगा rectovesical pouch. In females में होगा rectouterine. This is pouch of Douglas. pouch of Douglas. In standing position. In lying position, that's a Morrison's pouch. That's a hepatorenal pouch of Morrison. Rectovesical है बच्चे, rectovesical. ठीक है, fine, that's fine, that's fine. Okay. So we were discussing about the aortic arch arteries. बच्चे ये है aortic arch arteries. इसमें ना there are some important things to remember. ऐसे बोलो. Tell me if you can answer this. Arch of aorta. मतलब which is this arch artery? This is the fourth arch artery. That's the third arch artery. Okay, anyway, just tell me, arch of the aorta is derived from what? Arch of the aorta is derived from. Arch of the aorta is derived from. बोल सकते हो? अरे बच्चे, pouch of Douglas is between the pouch of Douglas is between the rectum and the uterus. रे बच्चे, it's between the rectum and the uterus. Sanvi, what happened, Sanvi? क्या क्लियर नहीं है? It's not clear. अरे इजी है ना बच्चे. एक मिनट है, just wait. Just wait. ये ना क्या डिफिकल्ट है इसमें, बोलो. This is easy ना बच्चे. ये देखो, that's a bladder. ये bladder है. This is the uterus. That's a uterus and that's a rectum. That's a rectum. हाँ, अभी बोलो, rectum पे ये पेरिटोनियम आ गया नीचे, ये रिफ्लेक्ट हो गया, ये ऐसे आया, ये ऐसे आया. So this is the bladder, this is the uterus, that's a rectum. So what is this pouch? This is the recto-uterine pouch. ये females में होगा ना. Recto-uterine pouch is the most dependent part of the body in standing position. Cardiac part. कौन सा बच्चे? कौन सा cardiac part? Okay, ये clear है ना? अच्छा, cardiac part पूछ रहे थे. Fine. Okay. चलो ये मैं बोल देता हूँ. हाँ, ये मैं बोल देता हूँ आपको. Just try to understand this. This is what we call as the aortic sac. Aortic sac. I'll just draw this. So how many pharyngeal arches are there to begin with? There are 6 pharyngeal arches, right? There are 6 pharyngeal arches. I'm telling you arches. Yeah, there are 6 pharyngeal arches. हर एक arch में there's an artery of the arch. हर एक arch की अपनी artery होती है, ठीक है? Now you tell me, this is the first arch artery. Just have a look. ये first arch artery है, ये second arch artery है. First arch artery, second arch artery. This is the third arch artery, fourth arch artery, fifth and sixth arch artery. 6 aortic arch arteries होती हैं. So that's the third, fourth, fifth and sixth aortic arch artery. ठीक है? So this is the aortic sac. Aortic sac. ये है first, second, third, fourth, fifth, sixth. 6 aortic arch arteries होती है. Just listen. Quickly, I'll finish this. Out of this, the first arch artery is the maxillary artery. Very good. The second arch artery को बोलते हैं stapedial artery. Very good. The first arch artery थोड़ी देर के लिए रहती है. Majority of it disappears off. Second arch artery disappears off. So I'll just make it like this. So first arch artery is gone. Second arch artery is gone. So first is gone. Second is gone. Fifth is gone. Fifth भी चली जाती है. Fifth is also gone. Fine. So अब अपने पास क्या है? What are we left with? We are left with third. This is the third arch artery. That's a fourth arch artery. That's a sixth arch artery. That's the aortic sac. And this is the dorsal aorta. ये जो देख रहे हो, that's a dorsal aorta. चलो, I'll start. Now, the sixth arch artery. Okay, ये थोड़ा सा ऊपर गया. The sixth arch artery is going to form. एक मिनट, ये थोड़ा सा यहाँ पे ऊपर गया. I'll just clear this, so you'll be confused then. Fine. Okay, so this is the third arch artery. That's the fourth arch artery. That's the sixth arch artery. The sixth arch artery is going to form the pulmonary artery. The sixth arch artery का क्या बनेगा? Pulmonary artery. It gives a bud here. यहाँ पे एक bud देता है for the lungs. This is an artery which goes to supply the lungs. So the sixth arch artery is going to form the future pulmonary artery. It gives a small artery to the lungs. On the right side, this part of the sixth arch artery between the lung bud and the aorta disappears off. On the right side, ये part चला जाता है. On the left side, this becomes the ductus arteriosus. Ductus arteriosus, ठीक है? So बच्चों, clear है? So look, sixth aortic arch artery forms the pulmonary artery. It gives a artery to the lungs. Right side पे this disappears off and this part of the sixth arch artery between the lung bud and the aorta से बनता है ductus arteriosus. अब यहाँ पे the recurrent laryngeal nerve winds around the ductus arteriosus and goes up. So the left recurrent laryngeal nerve is found in the thorax. On the right side, there's nothing to come up, there's nothing to wind around. So the right recurrent laryngeal nerve winds around the fourth arch artery. The fourth arch artery से बनती है subclavian artery. So the right recurrent laryngeal nerve winds around the subclavian artery. The left recurrent laryngeal nerve winds around the ductus arteriosus. I hope this is clear. Yes. Now, which is this arch artery? Fourth arch artery. The fourth arch artery, okay, ये है fourth arch artery. So 6 is over. Now there are two arteries which comes and joins the fourth arch artery. यहाँ से दो arch arteries आती है. इसका नाम है seventh cervical intersegmental artery. Seventh cervical intersegmental artery comes and joins with the fourth arch artery. ये fourth arch artery के साथ join होती है seventh cervical intersegmental artery. The aortic sac divides into a right and a left horn. हाँ, ये दो horns में divide करती है, right and left horns. I'll just explain this in brief. Now, चलो, I'll start. The left horn of aortic sac, the left horn of aortic sac and the left fourth arch artery forms the arch of aorta. So, arch of aorta is derived from the left horn of aortic sac and the left fourth arch artery. ये बनेगा arch of aorta. So the left 7 cervical intersegment से क्या बना? Left subclavian artery. Left subclavian artery is derived from the left 7 cervical intersegmental. The right subclavian artery is derived from the right 4th and the right 7 cervical. ये बनता है subclavian artery. ये बनता है subclavian artery. Are you able to follow this? ये arch of aorta है. So arch of aorta is derived from the left horn of aortic sac and the left fourth arch artery. Arch of aorta is derived from the left horn of aortic sac and the left fourth arch artery. The left 7 cervical intersegmental से क्या बना? Left subclavian artery. On the right side, the right fourth arch artery and the right 7 से क्या बना? Right subclavian artery. Fine. What is this right horn of aortic sac going to form? The right horn of aortic sac is going to form the brachiocephalic trunk. ये बनेगा brachiocephalic trunk. अब बचा क्या है? We are left with only one arch artery, that is the third arch artery. The third arch artery is going to form what? The common carotids. The third arch artery is going to form the common carotids, and that is why on the left side, the common carotids and the subclavian arise from arch of aorta. On the right side, the common carotid and subclavian arises from the brachiocephalic trunk. Fine है? Fine, Vicky Chaudhary. Okay, so in short, I've just explained this for you. So ये मैंने explain किया short में. Okay, fine. चलो. Coming to this, a very important MCQ. बच्चों, answer this. Skin over the angle of mandible is supplied by whom? Skin over the angle of mandible. Come on, that's very important. This you should know. The entire face, sensory supply of the face is trigeminal nerve, except the skin over the angle of the mandible. Bolo. Supplied by great auricular nerve. Very good. Skin over the angle of the mandible is supplied by the great auricular nerve, And this greater auricular nerve is a branch of cervical plexus. Excellent. And you know, there's a lesion of the skin over the parotid gland. वो है ना, डार्ट होता है ना, ऐसे मारते हैं, वो सर्कल होता है, the person hits with a pointer, वो डार्ट यहाँ पे लग जाता है. There's a perforating lesion of the skin over the parotid gland. जब regeneration होता है, so there's a mixing of fibers of the auriculotemporal nerve and greater auricular nerve. There's a mixing of fibers of the auriculotemporal nerve and greater auricular nerve. Now when a child starts to salivate, the child starts to get sweating of the skin over the parotid gland. What's that? The child starts to get sweating of the skin over the parotid gland. अरे बच्चे, marginal mandibular is a branch of facial nerve. बच्चे, smooth specialist, marginal mandibular nerve is a branch of facial nerve. It's a motor nerve. Marginal mandibular is a branch of facial. वो motor है. अपन sensory बोल रहे हैं, sensory है greater auricular nerve. That's Frei's syndrome. Very good. Frei's syndrome clear hai? So Frei's syndrome mein there's a lesion of the skin over the parotid gland. When the person salivates, the person gets sweating of the skin because of the mixing of greater auricular nerve and the auriculotemporal nerve, and this is what we call as Frei's syndrome. There's another syndrome when a child is having food, when an adult is having food, or the person starts to get tears. What is that? What is that? So gustatory sweating, Frei's syndrome, and crying while having food. What is that? What is that? बताइए. There's a mixing in high lesions of facial nerve. In high lesions of facial nerve, जब facial nerve की injury होती है, जब regeneration होता है, the fibers going to the lacrimal gland gets mixed with the fibers going to the submandibular gland. This is what we call as the crocodile tears. Crocodile tears. Very good. Crocodile tears. Yes. Crocodile tears. Crocodile tears is seen in high lesions of facial nerve. मतलब बहुत ऊपर facial nerve का जब injury होती है, जब regeneration होता है, the fibers going to the lacrimal gland gets mixed with the fibers going to the submandibular gland. So when the person salivates, the person starts to get tears, the crocodile tears. Yes, remember this, crocodile tears. Very good. बढ़िया है, बढ़िया. Answer. Ansa cervicalis supplies. Any guesses? Ansa cervicalis क्या supply करता है? Ansa cervicalis supplies this muscle, strap muscles. ये strap muscles है ना. Ansa cervicalis supplies the sternohyoid, the sternohyoid, sternothyroid, the superior and inferior belly of omohyoid. It supplies the strap muscles. It supplies the strap muscles. Okay, so now you tell me, what does the ansa cervicalis supply? It supplies the sternohyoid, sternothyroid, the superior and the inferior belly of omohyoid, right? Tell me, what does the ansa not supply? That's a very important MCQ. Ansa cervicalis does not supply one strap muscle. कौन सा है वो? कौन सा है वो मसल जिसे अंसा सप्लाई नहीं करता? Yes. Come on, that's very important. The strap muscle which is not supplied by ansa cervicalis is thyrohyoid. Thyrohyoid, nahi? It lies on the anterior wall of carotid sheath. That's fine. Thyrohyoid. Remember, that's a very important MCQ. Thyrohyoid is not supplied by ansa cervicalis, and thyroid and geniohyoid is supplied by C1. So thyrohyoid and geniohyoid. इसके साथ geniohyoid मैंने लिखा है. That is supplied by whom? C1. नहीं तो all strap muscles. Geniohyoid is not a strap muscle. वो strap muscle नहीं है, but it is supplied by C1. All strap muscles are supplied by ansa cervicalis except thyrohyoid, which is supplied by C1. Which other muscle is supplied by C1? Geniohyoid. वो याद रखना. Fine. Okay, can anyone tell me damage to the spinal accessory nerve in the posterior triangle? वैसे स्पाइनल एक्सेसरी नर्व दो मसल्स को सप्लाई करती है, sternocleidomastoid and the trapezius, right? Spinal accessory nerve supplies the sternocleidomastoid and the trapezius, but it first supplies the sternocleidomastoid and then it comes in the posterior triangle of the neck to supply the trapezius. वो पहले sternocleidomastoid को supply करती है. It first supplies the sternocleidomastoid. I'll draw this for you. Just one moment. Look. Fine. So that's a sternocleidomastoid. That's a trapezius. बोल सकते हैं what is this muscle? एक ही muscle draw कर रहा हूँ मैं. I'm just drawing one muscle on which the spinal accessory nerve lies. That's a spinal accessory nerve. So the spinal accessory nerve lies on which muscle? ये कौन से muscle पे होता है? The spinal accessory nerve lies on which muscle? That's the levator scapulae. Levator scapulae. So spinal accessory nerve lies on the levator scapulae. This nerve first supplies the sternocleidomastoid. ये पहले sternocleidomastoid को supply करती है. Then comes in the posterior triangle, lies on the levator scapulae, goes to supply the trapezius. Fine. अगर ये nerve को अपन यहाँ पे damage करता है, if the nerve is damaged here, sternocleidomastoid is already supplied. Sternocleidomastoid is already supplied. बच्चे उसको कुछ नहीं होता. The sternocleidomastoid को already supply हो चुका है. So if the nerve is damaged in the posterior triangle of the neck, which muscle is affected? Trapezius. समझ में आया? Very important clinical MCQ. बहुत important clinical MCQ है. In this posterior triangle we get large number of lymph nodes and there is abscess of the lymph node. So आप अगर lymph node को remove करते हैं, you're removing the lymph node or you're draining the abscess, the accessory nerve is very superficial. When we are removing the lymph node, the accessory nerve gets damaged, and damage to the spinal accessory nerve in the posterior triangle of the neck leads to paralysis of trapezius, not sternocleidomastoid. No, not sternocleidomastoid. It's only trapezius. What will the person complain of? The person complains of difficulty in shrugging of shoulder. The person complains of difficulty in overhead abduction, and there is winging of scapula at rest. Winging of scapula at rest. Okay, fine. So what does the person complain of? Person complains of loss of shrugging, loss of overhead abduction and winging of scapula at rest. Sternocleidomastoid को कुछ नहीं होता. There's no problem with sternocleidomastoid. Perfect है ये. So just remember this. Damage to the spinal accessory nerve in the posterior triangle leads to paralysis of trapezius. Fine. Okay. Relations in the lateral wall of the cavernous sinus. Can anyone tell me the relations in the lateral wall of cavernous sinus? Yes. अगर ये cavernous sinus मैंने draw किया, this I've drawn as the cavernous sinus. Who's this here? What's this and what's this? This is the pituitary gland. Pituitary. What is this below the pituitary gland? What is this? Sphenoidal. Sphenoidal air sinus. Sphenoidal air sinus. ऊपर क्या है? Optic chiasma. Optic chiasma. Tell me who's this? Third, fourth, ophthalmic, and the maxillary nerve. In the flow is the sixth nerve and internal carotid artery. So this is the cavernous sinus. Cavernous sinus. ये है slide. बस ये slide याद रखना. So who's on the medial wall of the cavernous sinus? The medial wall of cavernous sinus is related to the pituitary gland and the sphenoidal air sinus. The roof is the optic chiasma. The lateral wall में है third nerve, fourth nerve, ophthalmic and the maxillary nerve. Floor में होता है sixth nerve and the internal carotid artery. But recent books में mention किया है even the maxillary nerve is away from the cavernous sinus. रिसेंट एडिशंस में दिया है मैक्सिलरी नर्व इज ऑल्सो नॉट रिलेटेड टू द कैवर्नस साइनस इन द लैटरल वॉल। तो है ना क्या इंटरनल कैरोटिड एंड सिक्स नर्व इन द सेंटर, बच्चे वो फ्लोर है, फ्लोर एंड मीडियल है, फ्लोर एंड मीडियल, इट्स इन द फ्लोर एंड मीडियल, दैट्स फाइन, ठीक है। वो फ्लोर से जाके फिर रूफ में पियर्स करता है, फ्लोर से जाता है फिर रूफ को पियर्स करता है। क्लियर टू ऑल ऑफ यू? हाँ, क्लियर? It's in the floor and on the medial side. That's fine. That's a way of drawing. अगर MCQ आता है ना तो you have to really understand the MCQ. Recent editions में दिया है maxillary nerve is also not present in the lateral wall. हाँ, तो क्या बोल रहे हो? क्या बोल रहे हो? फ्लोर, रूफ। अरे बच्चे ये रूफ है, ये रूफ है, दिस इज द रूफ एंड दिस इज द फ्लोर, ये फ्लोर है, ठीक है, फाइन, चलो, ग्रेट। So relations of lateral of cavernous sinus clear. Perfect, perfect, excellent. This is a very, very important visual slide for you, bachcho. This is a very important visual slide for you. I'll point out certain things. Just try to identify them. Look, if you can identify them. Huh? Ha. Okay. पहले तो ये देखते हैं. What is this number 1 in red? What is this number 2? What is this number 3? And what is this number 4? These are the fascias of the neck. ये है fascias of the neck. बोल सकते हो? What is this 1, 2, 3, 4? Okay, fine. A very important visual slide, बच्चे. Very important visual slide. चलो, come on, answer this. जो आता है वो आंसर कर लो बच्चों. Whatever you know, that's fine. That's fine. You answer. Tell me what's number 1. ये ना, these are the deep cervical fascia बच्चे. हाँ, deep cervical fascia एक तो investing होता है, एक ट्रेकिया एंड थायराइड को कवर करता है, दैट्स प्रीट्रेकियल, एक वर्टिब्रल मसल्स को कवर करता है, दैट्स प्रीवर्टिब्रल, एंड द वन व्हिच इन्वेस्ट, दैट्स इन्वेस्टिंग लेयर ऑफ डीप सर्वाइकल फेशिया. ओके, सो 3 इज प्रीट्रेकियल fascia, 1 is investing layer of the deep cervical fascia, 2 is prevertebral. 4 carotid sheath है, 4 is carotid sheath. Fine. Can anyone tell me what is this structure? ये देखो ये. What is this structure? This. What lies medial to the carotid sheath? Medial to the carotid sheath. हाँ, क्या लिखा है? मैसेज नहीं शो हो रहा है. I don't know. दिख रहा है ना मैसेज? I don't know. ठीक है बच्चे, बोलो. What is this structure lying medial to the carotid sheath? हाँ हाँ, that's the sympathetic chain. Sympathetic chain है बच्चे, आंसर सर्वाइकलिस नहीं है. ये ना, ये जो मैंने एरो मार्क किया ना, दैट्स अ सिंपैथेटिक चेन. आंसर सर्वाइकलिस नहीं है बच्चे. आंसर सर्वाइकलिस विल बी हियर. देखो ऐसे होगा, एंटीरियर वॉल ऑफ कैरोटिड शीथ पे आंसर सर्वाइकलिस होगा. एंटीरियर वॉल ऑफ कैरोटिड शीथ पे आंसर सर्वाइकलिस होगा. दिस इज द सिंपैथेटिक चेन. याद रखना बच्चे, दिस इज वेरी वेरी इंपॉर्टेंट विजुअल स्लाइड. बहुत बार पूछा गया है ऑलरेडी. इट्स ऑलरेडी बीन आस्क्ड मेनी टाइम्स. सो दैट इज सिंपैथेटिक चेन. Can anyone tell me what is this? ये कौन है? ये नर्व कौन है? What is this nerve? आंसर एंटीरियर है, बराबर है. वो नर्व कौन है? देखो ना, हाउ डू यू अंडरस्टैंड दिस? कैसे समझोगे इसको? ये ट्रेकिया है ना, दिस इज द ईसोफेगस. तो ये क्या होगा? आंसर, ट्रेकिया एंड ईसोफेगस के बीच में रिकरेंट लैरिंजियल नर्व. वेरी गुड. सो दैट्स अ रिकरेंट लैरिंजियल नर्व. ट्रेकिया एंड ईसोफेगस के बीच में रिकरेंट लैरिंजियल नर्व. परफेक्ट बच्चे. गौरव, फ्रेनिक नहीं है. अभी मैं दिखाता हूँ. देखो, यू टेल मी व्हाट इज दिस. ये कौन है? ये देख रहे हो नर्व? हाँ, ये कौन है? हाँ, इंटरनल लैरिंजियल लिखा है क्या? हाँ, रिकरेंट लैरिंजियल. वेरी गुड. हाँ, व्हाट इज दिस नाउ? देखो, प्रीवर्टिब्रल फेशिया ये दिख रहा है. हाँ, दैट्स फाइन सनवी, दैट्स फाइन. ये मसल है, दिस इज स्केलेनस एंटीरियर, दिस मसल इज स्केलेनस एंटीरियर, एंड ये जो नर्व है ना विच लाइज ऑन द स्केलेनस एंटीरियर, दैट इज फ्रेनिक नर्व. ये जो देख रहे हो, दिस इज द फ्रेनिक नर्व, दैट्स अ फ्रेनिक नर्व. ठीक है, सो बस ये याद रखना, दिस इज द सेक्शन ऑफ द नेक. फ्रेनिक नर्व, हरीश वो फ्रेनिक नर्व है. हाँ, the muscle is scalenus anterior and the nerve lying on the scalenus anterior is phrenic nerve. Perfect. Okay. ठीक है ना सबको? Clear? Clear to all of you? I'll proceed. कुछ doubts है इसमें? तमिल? तमिल मरन? Fine. So now you tell me the branches of external carotid artery. So that's the external carotid. उसके branches हैं. Branches of external carotid artery. Easy है. So anterior branches is superior thyroid artery, lingual, facial. Posterior branches is posterior auricular and occipital. Medial branch is ascending pharyngeal and terminal branches superficial temporal artery and maxillary artery. Superficial temporal and maxillary artery. That's the brachial plexus. Yes, scalenus anterior and medius के बीच में is the brachial plexus. क्या हुआ smooth specialist? Your messages are seen, no दिख तो रहा है. Yes, ये brachial plexus है. ये ना ये scalenus anterior and medius के बीच में जो है, that's brachial plexus. That's brachial plexus. Smooth specialist. Okay, fine. Chalo. So ascending pharyngeal artery is a branch of external carotid. Ascending pharyngeal artery is a branch of external carotid. Can anyone tell me pharyngeal artery is a branch of what? Ascending pharyngeal is a branch of external carotid, but pharyngeal artery is the branch of what? Anyone? Come on. Pharyngeal artery is a branch of, any guesses? Yes, guess. This is very important. Smooth specialist, messages तो दिख रहे हैं आपके. हाँ, messages are seen. Any guesses? Pharyngeal artery is a branch of. वैसे ये जो maxillary artery है ना, this maxillary artery enters the infratemporal fossa. This maxillary artery is divided into 3 parts by lateral pterygoid muscle. जैसे axillary artery is divided into 3 parts by pectoralis minor, वैसे the maxillary artery is divided into 3 parts by lateral pterygoid, and the pharyngeal artery is a branch of maxillary artery. Pharyngeal artery is a branch of maxillary artery. Remember that. Ascending pharyngeal is a branch of external carotid, and pharyngeal artery is a branch of maxillary. Okay. Coming to this. Muscles of mastication. ये कौन है? Temporalis. This is the medial pterygoid. That's a medial pterygoid. This is the this is the masseter. I'm so sorry. Masseter. This is the medial pterygoid. मतलब angle पे बाहर is masseter, अंदर is medial pterygoid, and this is the lateral pterygoid. All the muscles of mastication are formed in the first pharyngeal arch. जितने भी muscles of mastication है, they are formed in the first pharyngeal arch. All these muscles of mastication are supplied by whom? The mandibular nerve. Mandibular nerve supply करती है. All the muscles of mastication are supplied by mandibular nerve. ये जितने भी muscles हैं, they are going to cause elevation of the mandible, except, answer this. All the muscles of mastication are going to cause elevation of the mandible, except, come on, that's very important, the only muscle of mastication which causes depression of the mandible is, any guesses? The only muscle which causes depression of the mandible, depression of TM joint. Yes, Harish. Bolo. Lateral pterygoid. Excellent. Very good. Very good. That's lateral pterygoid. ये याद रखना बच्चे बहुत ज़्यादा important है. The only muscle of mastication which causes depression of the TM joint is lateral pterygoid. And look at this. What's this? ये कौन है? That's the articular disc of TM joint. The articular disc of TM joint is a degenerated part of lateral pterygoid. Another very important MCQ. Very important MCQ. Retraction is temporalis, right? The only muscle, the articular disc of TM joint is a degenerated part of lateral pterygoid. And जब ये lateral pterygoid spasm में जाता है ना, when the lateral pterygoid goes in spasm, it pulls the articular disc in front. ये आगे खींच लेता है. It pulls the articular disc in front. Fine है बच्चों. Can anyone identify this structure? ये कौन है? ये. What is that? What is this structure? Identify. What is this structure and what is this muscle? Any guesses? That structure and that muscle. Lateral pterygoid है बच्चे. P-T-E-R-Y-G-O-I-D. P-T-E-R-Y-G-O-I-D. ये देखो. नहीं ये masseter नहीं बच्चे, ये masseter है. That's a masseter. ये masseter muscle है. What is this muscle and what is this muscle? What is that structure? Buccinator. This muscle is the buccinator, and what is this structure which pierces the buccinator? ये buccinator को pierce करती है. Anterior condyle process is temporalis, correct? That's correct. Anyone? Come on, bachcho. Which is the structure piercing the buccinator? That's very important. This is a structure which pierces the buccinator and it opens in the mouth opposite to the upper second molar tooth. I can't zoom this. इसे zoom नहीं कर सकता हूँ बच्चे. I can't zoom this. ये screen है. This is a screen. इसको zoom नहीं कर सकता हूँ मैं. अरे नहीं रे बच्चे, ये है ना, ये पैरोटिड डक्ट है बच्चे. पैरोटिड डक्ट, वो फेशियल नर्व नहीं है, फेशियल नर्व नहीं है. इट्स अ डक्ट. नहीं दिख रहा है वो? दिख नहीं रहा क्या? इट्स द डक्ट. पैरोटिड डक्ट है वो. ये बक्सिनेटर मसल है एंड द स्ट्रक्चर पियर्सिंग द बक्सिनेटर इज द पैरोटिड डक्ट. This parotid duct pierces the buccinator, opens in the mouth opposite to the upper second molar tooth. Upper second molar tooth. याद रखना, that's very important. Okay, now just see this. Can anyone tell me what is this number 1, 2, 3, 4? I'll just put numbers here. This is number 1, this is number 2, this is number 3. बोल सकते हो what is this 1, 2, 3, 4? ये है pharynx. Facial nerve supplies the buccinator without piercing it. Very good, very good, very good. ये pharynx है. This is another very important structure. ये pharynx है. These are the circular muscles of the pharynx. What is number 1, number 2 and number 3? 1, 2 and 3. 1 is the superior constrictor, 2 is the middle constrictor and 3 is the inferior constrictor. Superior constrictor, middle constrictor, inferior constrictor. Can anyone tell me structures passing above the superior constrictor? ये हमेशा आता है. Structures passing above the superior constrictor. Structures passing above the superior constrictor. बोल सकते हो? ये हमेशा आता है. This you have to know. This you have to know. Structures passing above the superior constrictor is the auditory tube. Auditory tube. Levator palatii. Levator palatii. Levator palatii muscle. Ascending palatine artery. Ascending palatine artery and palatine branches of ascending pharyngeal artery. That's a very important MCQ. Structures above the superior constrictor, that's the sinus of 𝐒𝐿-CCH. Very good, sinus of 𝐒𝐿-CCH. And structures passing through the sinus of 𝐒𝐿-CCH. One is the eustachian tube or the auditory tube. the levator palatal muscle, the ascending palatine artery, and the palatine branches of ascending pharyngeal artery. Okay, then coming to the next one, between the superior constrictor and middle constrictor. Between the superior and the middle constrictor goes the glossopharyngeal nerve and stylopharyngeus muscle. Glossopharyngeal nerve and stylopharyngeus muscle. Okay, then between the middle constrictor and inferior constrictor, and the last one is below the inferior constrictor. Below the inferior constrictor. So between the middle and inferior constrictor क्या जाता है and below the inferior constrictor क्या जाता है? This is internal laryngeal nerve and superior laryngeal vessels. Internal laryngeal nerve and superior laryngeal vessels. Below the inferior constrictor goes the recurrent laryngeal nerve and inferior laryngeal vessels. Just remember this, bachon, this is extremely important, extremely important. This is 1, this is 2, this is 3, and this is 4. Very good, very good. This you should know. बच्चे ये याद रखना. This is very important, very important. This you should know. वैसे internal laryngeal nerve क्या pierce करती है? It pierces the thyroid membrane. The internal laryngeal nerve also pierces the thyroid membrane and supplies the pyriform fossa. Internal laryngeal nerve also supplies the sensory supply to the larynx above the vocal folds. Recurrent laryngeal nerve supplies the sensory supply below the vocal folds. हाँ बोलता हूँ. All the muscles of the larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. All the muscles of larynx are supplied by recurrent laryngeal nerve except cricothyroid, जो external laryngeal nerve supply करती है, right? Structures above the superior constrictor or the sinus of Morgagni. One is the eustachian tube. Eustachian tube तो याद रहेगा. एक है elevator of the palate, that's a levator palati. एक है ascending palatine artery. Ascending palatine is a branch of facial. ये facial artery की branch है, and the palatine branches of ascending pharyngeal artery. ठीक है, ये याद रखना. ये पूरा टेबल मैंने दे दिया. हाँ, I've given you the entire table. Okay. Chalo, answer this. Structures passing to the superior orbital fissure. Okay, this is number 1. Superior orbital fissure kahan pe? This is the superior orbital fissure. Yes, superior orbital fissure. This is the optic canal. This is the foramen rotundum, foramen ovale, foramen spinosum, foramen lacerum. Foramen lacerum nahi diya isme. Chalo, answer this. This is 1, this is 2, this is 3, this is 4, 5, 6. This is 7, this is 8. Anterior condylar canal. Chalo bachcho, can you answer this? Superior orbital fissure से क्या क्या जाता है? Superior orbital fissure से जाती है 3, 4, 6 ophthalmic nerve. 3, 4, 6 and ophthalmic division of trigeminal nerve. Very good. What passes to the optic canal is the optic nerve and the ophthalmic artery. Optic nerve and ophthalmic artery. That's the optic canal. मैंने वो लगा दिया वहाँ पे आपके लिए. What passes to foramen rotundum? Yes, anyone? That's a maxillary nerve. Maxillary nerve. Foramen rotundum, maxillary nerve. Yes. What passes to foramen ovale? Foramen ovale याद है आपको? M-A-L-E. याद है? M is the mandibular nerve. M is the mandibular nerve. A is the accessory meningeal artery. L, lesser petrosal nerve. E, emissary vein. Emissary vein, right? Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary vein. Male. वो सब वो है ना, वाइवा में स्टूडेंट्स आते हैं. I ask, what is this? Sir, foramen ovale, structures passing. Sir, male. Very common. So mandibular nerve, axillary meningeal artery, lesser petrosal nerve, emissary vein. Fine. Now foramen spinosum. Foramen spinosum आपने देखा, what passes to foramen spinosum is the middle meningeal artery and nervous spinosus. Nervous spinosus. Middle meningeal artery and nervous spinosus. ठीक है. So what passes to foramen spinosum is the middle meningeal artery and the nervous spinosus. Foramen lacerum से क्या जाता है? Internal carotid artery and the deep petrosal nerve. Internal carotid artery and the deep petrosal nerve. Deep petrosal nerve comes from the sympathetic plexus. Sympathetic plexus से आती है. ठीक है. हाँ, extradural hemorrhage. Very good. Good, good. चलो ऐसे ना, ऐसे कोरिलेट करना बच्चों. हाँ, लाइक आपने अभी लिखा मिडिल मेनिंजियल आर्टरी इज आर्टरी ऑफ एक्स्ट्राड्यूरल हेमोरेज. एक्सीलेंट, वेरी गुड. ऐसे क्रॉस कोरिलेशन होना चाहिए, क्रॉस रेफरेंसेस आना चाहिए, देन इट बिकम्स वेरी इजी, वेरी इंटरेस्टिंग, कोरिलेटिव. राइट बच्चे, सब ये तो देख रहे हो आप, बट इसके बाद मेक एन अटेम्प्ट टू गिव द ग्रैंड टेस्ट. हमारा ग्रैंड टेस्ट भी चल रहा है पीडब्ल्यू ऐप पे. मेक इट अ पॉइंट टू गिव द ग्रैंड टेस्ट. इंटरनल acoustic meatus. इंटरनल acoustic meatus में क्या जाता है? सेवेंथ नर्व, एथ नर्व एंड labyrinthine artery. सेवेंथ नर्व, एथ नर्व एंड labyrinthine artery. ठीक है. एंटीरियर कॉन्डलर कैनाल से क्या जाता है? हाइपोग्लॉसल नर्व. हाइपोग्लॉसल नर्व. सेवेंथ नर्व, एथ नर्व एंड labyrinthine artery है. And anterior condylar canal is hypoglossal canal. Anterior condylar canal है ना बच्चे, that is hypoglossal canal. What passes through that is hypoglossal nerve. Hypoglossal nerve. Very good, excellent. चलो, this all is very important है बच्चे, ये सब बहुत important है, अच्छे याद रखना. एक जुगुलर फोरामेन इसमें दिया नहीं है. जुगुलर फोरामेन से क्या आ जाता है, बोल सकते हो? जुगुलर फोरामेन. जुगुलर फोरामेन के 3 कंपार्टमेंट्स हैं, एंटीरियर, मिडिल, posterior. एंटी, मिडल एंड पोस्टीरियर. एंटीरियर कंपार्टमेंट से जाती है इंफीरियर पेट्रोसल साइनस. मिडिल कंपार्टमेंट से जाती है 9th, 10th, 11th cranial nerves एंड पोस्टीरियर कंपार्टमेंट से जाती है sigmoid sinus. sigmoid sinus, राइट, ये याद रखना. So ये कभी-कभी clinical MCQ comes. There's a tumor which compresses the jugular foramen. So which of the following symptoms will be seen? So you have to remember this. 9th, 10th cranial nerve. Yes, good. चलो ठीक है. Can anyone tell me this? चलो, good. You tell me what is this, what is this, and what is this? चलो start. What is this number 1? What is this number 2? And what is this number 3? Inferior petrosal sinus goes to the anterior compartment. Yes, very good. यह है section of the larynx. बच्चे, यह है section of the larynx. हाँ, ये larynx का हमने section दिया. Can anyone tell me what is this? 1. This is number 1. This is number 2. This is number 3. This is number 4. Come on. That's a section. ये larynx है. This is a section of the larynx. Come on. Bolo. What's that? What's number 1? Guess karo. Okay. So 1 are the vestibular folds. 1 is the vestibular folds. 2 is the vocal folds. 3 is the sinus or ventricle of larynx. Sinus or ventricle of larynx. One is vestibular fold, 2 is vocal fold, and 3 is sinus of the larynx. बच्चे ये बहुत ज्यादा इंपॉर्टेंट है, ये सब विजुअल्स याद रखना. नंबर 4 क्या हो सकता है? Who is number 4? Number 4 is the epiglottis. Number 4 is the epiglottis. Fine. हाँ, तो अभी क्लियर है बच्चे, क्लियर है? दिस इज द वेस्टिबुलर फोल्ड, ऊपर वाला वेस्टिबुलर फोल्ड है, नीचे वाला वोकल फोल्ड है, बीच में जो स्पेस है दैट्स अ साइनस ऑफ द लैरिंक्स, एंड 4 इज एपिग्लॉटिस. मतलब ये सेक्शन है दैट्स अ सैजिटल सेक्शन. इफ यू सी इट लाइक दिस, अगर ऐसे देखोगे, सो ये ना, दिस इज वन फोल्ड, this is second fold, and this is this. So ये same है, the same thing I've drawn. This is number 1, this is number 2, this is number 3. So one is vestibular fold, दूसरा है vocal fold. अब ये दोनों sides का है. This is a coronal section. So vestibular fold, vocal fold, 3 is sinus of the larynx. अब what is the space? अब बोलो what is the space between the two vestibular folds? What is the space between the two vocal folds? इसका नाम है रीमा glottitis, and ये है रीमा vestibuli. So the space between the two vestibular folds है ना, ये ऐसे दो होंगे ना. This is one vestibular fold, this is one vestibular fold. The space between the two vestibular folds is रीमा vestibuli. The space between the two vocal folds is रीमा glottitis, and between one vestibular fold and vocal fold जो space है that's the sinus of the larynx. Fine. Clear है बच्चों? ये clear है? हाँ, tell me if this is clear. I'll proceed. 4 epiglottis है, बराबर है. This is a sagittal section, that's a coronal section. वो coronal section है, वो हमने ऐसे लिया तो उसमें दोनों vocals and vestibular folds दिखता है. This is a sagittal section, तो इसमें एक ही vestibular and vocal fold दिखेगा. Okay, great. हाँ, ये jugular foramen अभी हमने देखा. We've just seen the jugular foramen. Okay, just tell me the nerves of the pharyngeal arches. Let us understand the nerves of the pharyngeal arches. Arish, ठीक है ना? Nerves of the pharyngeal arches. The first arch की nerve बोलो. Nerves of the pharyngeal arches. Chalo, we'll start with this. Come on, come on, come on, come on, come on, come on. The nerves of the pharyngeal arches. Any guesses? Which is the nerve of the first arch? Mandibular. The nerve of the second arch? Facial. The nerve of the third arch is glossopharyngeal. The nerve of the fourth arch? Fourth arch? ये 4 double आ गया. Nerve of the fourth arch is superior laryngeal nerve, and the nerve of the sixth arch is recurrent laryngeal nerve. Recurrent laryngeal nerve. ठीक है ना? हाँ. Which are the muscles of the first arch? Muscles भी बोल ही दो, अभी इतना you have told me. So tell me the muscles of the first arch. The muscles of mastication. Mastication. The muscles of mastication were temporalis, masseter, medial and lateral pterygoids. फिर anterior belly of digastric, anterior belly of digastric, mylohyoid, tensor palati and tensor tympani. Tensor palati and tensor tympani. Okay, fine. Okay, come back. ठीक है, so mandibular nerve is the nerve of the first arch. Which are the muscles formed in the first arch? One is the muscles of mastication, फिर एक tensor palati, tensor tympani, the mylohyoid and the anterior belly of digastric. So these are the muscles of the first arch. Second arch के muscles, the muscles of facial expression, muscles of facial expression. What else? Stapedius, muscles of facial expression, stapedius. Then posterior belly of digastric and stylohyoid. Stylohyoid. ये याद रखना, ये सब पूछते हैं. All this comes in the MCQs. Muscles of facial expression, the stapedius, the posterior belly of digastric, and the stylohyoid. Fine. Oh, there's only one muscle in the third arch. Can you name this muscle? Third arch, third arch, third arch, third arch में एक ही muscle है, नाम बताओ. Name the muscle in the third arch. Muscle in the third arch. Only one muscle. Name? Stylopharyngeus. That's very important. बच्चे याद रखना, muscle in the third arch is stylopharyngeus. ठीक है. 4th arch में cricothyroid, and 6th arch में muscles of larynx, the rest muscles of the larynx and pharynx. 6th arch में बस बचे हुए muscles हैं, muscles of the larynx and pharynx. बस इतना याद रखना. This all is very important. Okay. Fine. So we proceed then. Wow, that's a middle ear cavity. Come on. The relations of the middle ear, that's the anterior wall. ये है posterior wall. Anterior posterior हो गया. ये हो गया roof. ये हो गया floor. ये है medial wall and the lateral wall we have removed. Lateral wall को हमने निकाल दिया है. So बच्चों, tell me the anterior wall of middle ear shows two openings. One is the tensor tympani, दूसरा है eustachian tube. नीचे होती है internal carotid artery. Cricothyroid. हाँ, मैंने क्या लिखा फिर? Cricothyroid है ना बच्चे. Cricothyroid is a tensor of vocal cord which is supplied by external laryngeal nerve. Superior laryngeal की branch है external laryngeal nerve that supplies the cricothyroid, which is a muscle of larynx, extrinsic muscle. बाकी जितने भी muscles हैं of the larynx is supplied by recurrent laryngeal nerve. Fine. Okay, so coming to the anterior wall of middle ear, दो openings हैं. One is for the tensor tympani, दूसरा is for the eustachian tube, and below होता है internal carotid artery. The posterior wall shows an opening to the adytus, to the mastoid. पीछे क्या होता है? Adytus to the mastoid. Fine. The posterior wall shows this is for the pyramidal eminence. यहाँ पे stapedius muscle attached होता है, and there's a small passage for the chorda tympani nerve. ये chorda tympani nerve यहाँ से अंदर आती है. The roof is formed by tegment tympani. फ्लोर में क्या होता है? फ्लोर में होता है internal jugular vein, and there's the tympanic branch of glossopharyngeal nerve. फ्लोर में होता है internal jugular vein and the tympanic branch of glossopharyngeal nerve. बस इतना ही याद रखना. The medial wall shows a elevation. इसका नाम है promontory. What is this? Promontory. And ये promontory के ऊपर is the tympanic plexus. Oval window which is closed by footplate of stapes. The round window which is closed by secondary tympanic membrane. This is the facial canal. The facial nerve forms a prominence, that's a facial canal, and this is the prominence of lateral semicircular canal. That's it. Can anyone tell me what is the nerve supply of middle ear? ये बस ये diagram याद रखना. Diagram is very self-explanatory. What is the nerve supply of middle ear cavity? Nerve supply of middle ear cavity बोल सकते हो? The glossopharyngeal nerve through the tympanic plexus. Glossopharyngeal nerve through the tympanic plexus is going to supply the middle ear cavity. Glossopharyngeal nerve through the tympanic plexus supplies the middle ear cavity. Fine. Okay, बस ये याद रखना आपको. Just remember the slide. हाँ, ठीक है. बस यही याद रखना. These are the endodermal pouches. From the first endodermal pouch, you get tubotympanic recess. इससे बनता है middle ear cavity and auditory tube. This is very important. From the first endodermal pouch, you get what is known as tubotympanic recess. This tubotympanic recess forms the middle ear cavity and eustachian tube. The second endodermal pouch forms the tonsils. The third divides into a dorsal and a ventral part. The ventral part forms the thymus, and the dorsal part forms the inferior parathyroids. The fourth divides into a dorsal and ventral. The dorsal forms the superior parathyroids, and the ventral joins the sixth to form ultimobranchial body, ultimobranchial body, and this ultimobranchial body forms the parafollicular C cells of thyroid. Ultimobranchial body से क्या बनता है? Parafollicular C cells of thyroid. Parafollicular C cells of thyroid. But parafollicular C cells of thyroid are said to be derived from neural crest cells. अगर MCQ आता है parafollicular C cells of thyroid are derived from, आपका first answer होगा, your first answer is going to be the neural crest cells. Okay, your first answer is going to be the neural crest cells. अगर वो option में नहीं है, your second answer is going to be the ultimobranchial body. ठीक है बच्चे, तो याद रखना एंडोडर्मल पाउचेस के डेरिवेटिव्स आते हैं. थाइमस इज डिराइव्ड फ्रॉम द थर्ड एंडोडर्मल पाउच. उसके साथ क्या फॉर्म होता है? इंफीरियर पैराथायरॉइड. फोर्थ से बनता है सुपीरियर पैराथायरॉइड एंड द फोर्थ जॉइंस विद द सिक्स्थ टू फॉर्म द अल्टीमोब्रैंकियल बॉडी. हाँ, वेरी गुड विक्की, वेरी गुड, फाइन. नो, याद रखिए ये, दिस इज वेरी इंपॉर्टेंट. क्लियर है? आई प्रोसीड. चलो प्रोसीड देन. चलो कुछ एमसीक्यूज हैं, कुछ एमसीक्यूज हैं. आंसर दिस. Wernicke's area. Wernicke's area is which area? Wernicke's area is area number 22. That's a sensory speech area, right? Broca's area is 44, 45. That's a motor speech area. Motor speech area. अगर ये डैमेज हुआ तो ये बनता है मोटर एफेजिया. मोटर एफेजिया. अगर ये डैमेज हुआ तो सेंसरी एफेजिया. Sensory aphasia. And you tell me there's a connection between these two. The Broca's and the Wernicke's areas are connected. What is this connection known as? बोल सकते हो? हाँ, अरे वो तो लिखा है नीचे. Right, it is written down. The connection between the Broca's and Wernicke's area is known as uncinate fasciculus. Connects Broca's and Wernicke's area. Uncinate fasciculus. बच्चों आंसर करो. Yes, so Wernicke's area is area number 22. Broca's area is area number 44, 45. The connection between the Wernicke's and Broca's area is the uncinate fasciculus or arcuate fasciculus. Arcuate fasciculus. Blood supply of the motor or the sensory cortex. बोल सकते हो? What is the answer for this? Blood supply of the motor area. Can anyone answer this? थक गए सब? Answer this. What is this artery here? That's a middle cerebral artery. So the middle cerebral artery supplies the entire supralateral surface. A small area here is supplied by whom? Anterior cerebral artery. And the occipital lobe is supplied by posterior cerebral artery. Hello, where are all of you? दिख नहीं रहा मुझे. I'm not able to see your comments. हाँ, very good. आ गया. So tell me now, what is this? That's a central sulcus, precentral, postcentral. So this is the motor area, that's a sensory area. Motor area and sensory area. अब इतना जो part है, it is supplied by whom? Middle cerebral, and this part is supplied by anterior cerebral. So middle cerebral artery plus anterior cerebral artery, that's a blood supply of motor और sensory area. मोटर और सेंसरी एरिया का ब्लड सप्लाई मिडिल एंड एंटीरियर सेरेब्रल. दोनों है बच्चे, दोनों है. इट्स नॉट ओनली मिडिल सेरेब्रल, इट्स बोथ मिडिल एंड एंटीरियर सेरेब्रल. दोनों, मिडिल एज वेल एज एंटीरियर सेरेब्रल आर्टरी. ठीक है. Whereas blood supply of the occipital lobe of visual cortex. Visual cortex is supplied by visual cortex is mainly supplied by posterior cerebral artery plus middle cerebral artery supplies the macula. So ये हमेशा आता है बच्चे. This always comes. What is the blood supply of the occipital lobe or the visual cortex? Students answer this as posterior cerebral. But remember, posterior cerebral supplies the major part. Posterior cerebral supplies the major part of occipital lobe, whereas वो macula and macula is the area of fine vision, and the macula is supplied by middle cerebral artery. तो अगर एमसीक्यू आता है ब्लड सप्लाई ऑफ द विजुअल कॉर्टेक्स, योर आंसर इज गोइंग टू बी द मिडिल सेरेब्रल एंड द पोस्टीरियर सेरेब्रल. ओनली पोस्टीरियर सेरेब्रल नहीं लिखना है, इट्स पोस्टीरियर एंड द मिडिल सेरेब्रल आर्टरी. तो व्हेन द पोस्टीरियर सेरेब्रल आर्टरी का थ्रोम्बोसिस होता है, there's a blindness with macular sparing. Blindness with macular sparing, right? Because macula को कौन सप्लाई करता है? मिडिल सेरेब्रल आर्टरी. Whereas the motor or the sensory area is supplied by two arteries, middle as well as anterior cerebral. दो arteries हैं, middle as well as anterior cerebral. ठीक है बच्चों, क्लियर है? हाँ, this is very important. This is very confusing. ये हमेशा confuse होते हैं बच्चे. and that is why these questions are always asked. Okay, I've been teaching this PG entrances since last 25 years. Clear? Okay, fine. So this is clear. So blood supply of motor or sensory area क्या होगा? MCA plus ACA. Blood supply of the visual cortex is posterior cerebral artery plus middle cerebral artery as a macula. Fine है? Clear to all of you? I'll just tell you one slide I'll draw for you. बस ये याद रखना. So I'll just draw one easy slide for you. Huh? There are three veins like this. There are three veins here, and this three veins joins here. तीन veins है ऐसे, and this three veins joins here, and this is what we call as the internal cerebral vein. Internal cerebral vein. This is one internal cerebral. That's another internal cerebral vein. Two internal cerebral vein joins to form two internal cerebral vein joins to form the great cerebral vein. Great cerebral vein of Galen. And this great cerebral vein of Galen drains into what? Straight sinus. बस ये याद रखना. हाँ. So internal cerebral vein is a deep vein of the brain. हाँ, बस ये table याद रखना. This is very easy. I'm making it very easy for you. Two internal cerebral vein joins to form the great cerebral vein. Great cerebral vein of Galen drains into straight sinus. The internal cerebral vein itself is formed by joining of three veins. One is thalamostriate. दूसरा है choroidal, and third is septal. So thalamostriate vein, choroidal vein, and septal vein. ये तीन veins है joins to form the internal cerebral vein. Internal cerebral vein is a deep vein of the brain. Two internal cerebral vein joins to form the great cerebral vein of Galen, and the great cerebral vein of Galen drains into straight sinus. Now, there's a vein which drains into the great cerebral vein of Galen, and this is the basal vein. And this basal vein is formed by the joining of three veins. दोनों sides पे, I'm drawing only one. So the basal vein is formed by the joining of anterior cerebral vein, the deep middle cerebral, and the striate veins. Anterior cerebral, the deep middle cerebral, and the striate vein joins to form the basal vein, and this basal vein drains into the great cerebral vein. बस ये याद रखना है आपको. Just remember this. Okay. Fine है. Look at this slide. So, what is this vein? Now you answer. What is this? That's an internal cerebral vein. Internal cerebral vein joins to form. This is the great cerebral vein of Galen. And what is this? That's a basal vein, right? That's a basal vein. That's a basal vein. So what drains here is the basal vein. Take it, that's a basal vein. So internal cerebral vein, two internal cerebral vein joins to form the great cerebral vein. What drains into this is the basal vein. This basal vein will form by joining of three veins. वो draw नहीं किया है, fine. Now what are these three veins? This is 1, this is 2, and this is 3. This is the thalamostride, this is a choroidal, and that's a septal vein. ये choroidal vein है, that's a septal vein, that's a thalamostride, that's a septal vein, joins to form the internal cerebral vein. Two internal cerebral vein joins to form the great cerebral vein, and what drains into the great cerebral vein is the basal vein. Fine है, बस ये याद रखना. Just remember this. Okay. Now tell me, what is this? What is this nerve? ये कौन है? Number 1 and 2. Can anyone tell me? ये है brainstem. आप पीछे से देख रहे हो. You're seeing the brainstem from back side. What is number 1 and what is number 2? Come on, students. Yes, Ankita. Ankita Majan. Tell me what's number 1 and what's number 2. Can anyone tell me what's number 1 and 2? Great cerebral vein of Galen malformation. Bolo na. Bolo. If you know, you answer. Okay, tell me what's number 1. ये है midbrain, ये है pons, ये है medulla. This is the fourth ventricle. ये है fourth ventricle. Fine. So what is 1 and 2? That's the superior colliculus, inferior colliculus. Superior colliculus, inferior colliculus. What is this nerve? The only cranial nerve which emerges from the dorsal aspect. Anyone? The only cranial nerve which emerges from the dorsal aspect of the brainstem is trochlear nerve. Trochlear. The only cranial nerve जो पीछे से आ रही है, that's trochlear nerve. What is this elevation known as? That's a facial colliculus. That's a facial colliculus, and the facial colliculus is formed by the fibers of facial nerve as they wind around the abducens nucleus, right? The fibers of facial nerve as they wind around the abducens nucleus, that is the facial, that's a facial colliculus, fine? That's a facial colliculus. What is this triangle? This is the hypoglossal triangle, that's a vagal triangle. Hypoglossal triangle and vagal triangle. Fine. Nothing specific here. Tell me, chalo, I'll just point out structures. What is this number 1? What is this number 2? What is this number 3? And what is this number 4? Number 4. Chalo, answer this. Answer this, bacho. This is very important. What is 1, 2, 3, 4? That's a horizontal section through the brain. Horizontal section taken through the brain. This is very important. ये visuals आते हैं, हाँ, या फिर ये CT, MRI होता है, and something is pointed. You are asked to identify what is this. Come on, students, come on. A last part is left. Be active and answer. Yes, come on. What's 1? क्या लिखा? GP. What is GP? Okay. What's number 1? Number 1 is the thalamus. Number 1 is the caudate nucleus. That's a caudate nucleus. Number 2 is the thalamus. Number 3 is the lentiform nucleus. The lentiform nucleus is formed by globus pallidus and putamen. What is number 4? Number 4 is the internal capsule. Internal capsule. What is this? Corpus callosum. Corpus callosum. This is the fornix. Pharynx, pharynx, and this is the lateral ventricle. That's a lateral ventricle. ये जो cavity देख रहे हो, that's a lateral ventricle. This is very important section. 1 is the caudate nucleus, 2 है thalamus, 3 है lentiform nucleus, 4 that's the internal capsule. This is the fornix, this is the corpus callosum, that's a corpus callosum. Fine. Now I'll just tell you the attachment of cranial nerves. If you can answer this. Look, this is the midbrain, that's the pons, that's a medulla, that's the pyramids, that's the olives, That's an inferior cerebellar peduncle. This is the middle cerebellar peduncle. Chalo, start. What is this nerve? And what is this nerve? What is this nerve? Sorry. Answer. Answer this. So it's the inferior cerebellar peduncle. Any guesses? So this is the third nerve. What's this now? Fourth. That's a fifth. 6, 7, 8, 9, 10, 11. That's a 12th nerve. This is very important. So the third and the fourth nerves are attached to the midbrain. All the cranial nerves comes from the ventral aspect. Jitne bhi cranial nerves hai, they come from the ventral aspect, except the trochlear nerve comes from the dorsal aspect. So third and the fourth nerve is attached to the midbrain. The nerve attached at the junction of pons with the middle cerebellar peduncle. Pons and middle cerebellar peduncle के junction पे जो है, that is fifth nerve. Fifth nerve. ये जो pontomedullary junction है, pontomedullary junction is 6, 7, 8. Pontomedullary junction पे जो nerve है, that's 6, 7, 8. Between the olives and the inferior cerebellar peduncle, 9, 10, 11, and between the pyramids and the olives is the 12th nerve. 12th nerve. Is this clear to all of you? And nerves attached to the brainstem, ये याद रखना है. This is very, very important. ठीक है? That's very important. Look at this. That's a third nerve, that's a fourth nerve, that's a fifth nerve, 6, 7, 8, फिर 9, 10, 11, and this is the 12th nerve. बस उतना याद रखना. बच्चों क्लियर है? Proceed करते हैं. Shall we proceed? Yes, students, are you able to understand? Enjoying? समझ में आ रहा है सब? Okay, all important topics we are trying to cover in this INI-CET marathon session of anatomy. A special effort done by PW Merit team आपके लिए. ठीक है, एक बार ये सब क्लियर हो जाएगा बच्चों, तो make it a point to give the grand test on PW Merit app. Make it a point to give. So revision हो जाएगा. ठीक है, चलो, let us start. Okay. Come on. So this is the anterior abdominal wall. What is this? That's a superficial inguinal ring. यहाँ पे होगा deep inguinal ring. These are the layers of anterior abdominal wall. Rectus abdominis. Fine. So deep inguinal ring is a defect in fascia transversalis. The superficial inguinal ring is a defect in external oblique aponeurosis. External oblique aponeurosis. Which nerve is present in the inguinal canal? बोल सकते हो? Which is the nerve present in the inguinal canal? Nerve present in the inguinal canal is, मतलब contents of inguinal canal बोल दो. Contents of inguinal canal in males and females. Contents of inguinal canal in males and females. Males में क्या होगा? Spermatic cord and ilio-inguinal nerve. Females में होगा round ligament and ilio-inguinal nerve. ठीक है? So spermatic cord and the ilio-inguinal nerve. Females में होगा round ligament of uterus and the ilio-inguinal nerve. Fine. Contents of spermatic cord, ये भी हमेशा पूछते हैं. Contents of spermatic cord, one is vas deferens, second is artery to the vas, the testicular artery, the cremasteric artery, the pampniform plexus of veins, the genital branch of genitofemoral nerve, and the lymphatics from the testis. Lymphatics from the testis. ये याद रखना, बहुत important है. Contents of spermatic cord. एक बार वापस, the vas deferens, the artery to the vas, the cremasteric artery, the testicular artery, the pamniform plexus of veins, the genital branch of genitofemoral nerve, and the lymphatics from the testis. All this is tied together. ये बना अपना spermatic cord. Spermatic cord. Fine. Okay. Testicular artery is a branch of what? Anyone? Can anyone tell me? Testicular artery is a branch of. Come on, come on, come on, come on. Answer. Testicular artery. Testicular or ovarian, जिसे हम बोलते हैं gonadal artery. That's a branch of. Any guesses? Any guesses? Any guesses? Any guesses? Come on, come on, come on, बच्चों बहुत important है testicular artery और ovarian artery जिसे हम बोलते हैं gonadal artery. That is a branch of what? हाँ, बोलो. A direct branch from the abdominal aorta. Direct branch from abdominal aorta. बच्चे branches of abdominal aorta पता है 2, 3, 4, 5. ये याद रखना. 2 are terminal branches. Terminal branches are common iliacs. 3 ventral branches. एक है celiac trunk, superior mesenteric, inferior mesenteric. 4 है lateral branches. Inferior phrenic, middle suprarenal, renal, gonadal. 5 dorsal branches. Dorsal branches में 4 pairs of lumbar arteries and 1 median sacral artery. 4 pairs of lumbar arteries and 1 is a median sacral artery. So just remember the branches of abdominal aorta 2, 3, 4, 5. That's a mnemonic. Anterior division of interiliac का नहीं है branch बच्चे. No. Sanvi. Testicular artery is a branch of abdominal aorta. Abdominal aorta. याद रखना. Okay, बच्चों, come on. Can anyone tell me what is this foramen? ये foramen का नाम क्या है? That's the epiploic foramen. Epiploic foramen. Epiploic foramen के boundaries बोल सकते हो आप? Epiploic foramen के boundaries, boundaries, boundaries. Epiploic foramen के boundaries. Anyone? Epiploic foramen. Answer this. Anterior is the lesser omentum. Anterior is the lesser omentum containing hepatic artery, portal vein, bile duct. Hepatic artery, portal vein, bile duct. Huh. Posterior is the IVC. Superior is the caudate lobe. Caudate lobe of liver. Inferiorly is the first part of duodenum. Inferiorly is the first part of duodenum. एओर्टा के ब्रांचेस रिपीट करूं? अच्छा ठीक है सनवी, बोलता हूं बच्चे. एओर्टा के ब्रांचेस बोलता हूं. सो एपिप्लाइक फोरामेन के बाउंड्रीज सुन लो पहले. एंटीरियर इज द लेस ओमेंटम. लेस ओमेंटम में होता है हेपाटिक आर्टरी, पोर्टल वेन एंड बाइल डक्ट. hepatic artery, portal vein and bile duct. So anteriorly is the less omentum containing hepatic artery, portal vein, bile duct. Posterior is IVC. Superiorly is the caudate lobe of liver. Inferiorly is the first part of duodenum. First part of duodenum. याद रखना बहुत ज्यादा इंपॉर्टेंट है. एपिप्लॉइक फोरामेन. दूसरा नाम है फोरामेन ऑफ विंस्लो. फोरामेन ऑफ विंस्लो. ब्रांचेस ऑफ एब्डोमिनल एओर्टा बोलता हूं बच्चे. ब्रांचेस ऑफ एब्डोमिनल एओर्टा कैसे याद रखोगे इसको? 2, 3, 4, 5. 2 क्या है? 2 are terminal branches. 2 is terminal branches, that's common iliacs. Common iliacs. 3 is ventral branches. Ventral branches में 1 is celiac trunk. Celiac trunk का vertebral level is T12. Second is superior mesenteric artery. Vertebral level L1. Inferior mesenteric artery. Vertebral level is L3. ठीक है. Celiac trunk, superior mesenteric, inferior mesenteric. ये याद रखना. vertebral level से याद रखना. Celiac trunk vertebral level is T12, superior mesenteric L1, inferior mesenteric is L3. 4 are the lateral branches. Lateral branches में first is inferior phrenic. Second is middle suprarenal. Third is renal. And fourth is gonadal. Okay, and 5 is dorsal branches. Dorsal branches में 4 pairs of lumbar artery and 1 median sacral artery. 4 pairs of lumbar arteries and 1 median sacral artery. ठीक है बच्चे, all clear? Sanvi, clear? I think it is going back. ठीक है, fine है. So these are the branches of abdominal aorta. Just remember that mnemonic 2, 3, 4, 5. Okay. There are a lot of my posts on Instagram. Instagram post है मेरे काफी, उसमें ना छोटे छोटे MCQs. I tell MCQs in a understanding way, in a different way. Okay, तो बहुत सारे MCQs भी discuss like that. तो वो भी आप देख लो. ठीक है. So this is fine. Okay, बच्चे. Okay, thank you बच्चा. Thank you. Now look. I'll tell you something about fetal circulation. बहुत ज़्यादा important है बच्चे, बहुत ज़्यादा important है fetal circulation. Okay, so we start with fetal circulation. That is the umbilical cord. Contents बोल सकते हो. There are 2 umbilical arteries and this the left umbilical vein. So contents of umbilical cord, 2 umbilical arteries and the left umbilical vein. I'm telling you fetal circulation बच्चे, fetal circulation. The left umbilical vein goes and joins with what? ये जो left umbilical vein है, it goes and joins with the left branch of portal vein. The left umbilical vein goes and joins with the left branch of portal vein. ठीक है. अब umbilical vein कहाँ से आती है? It comes from the placenta, है ना? Umbilical vein comes from the placenta. It is carrying pure blood from the placenta. The left umbilical vein comes and joins with the left branch of portal vein. अब from the portal vein, the blood will go to the liver. अरे अगर ये प्योर ब्लड लीवर में गया, द लीवर विल यूज ऑल दिस प्योर ब्लड फॉर इट्स ओन मेटाबॉलिज्म. लीवर पूरा प्योर ब्लड खा लेगा. सो देयर इज अ बाईपास, देयर इज अ बिग बाईपास. दिस इज अ IVC एंड यहाँ पे एक बाईपास होता है फ्रॉम द लेफ्ट ब्रांच ऑफ पोर्टल वेन टू द IVC. दिस इज नोन एज द डक्टस वेनोसिस. डक्टस वेनोसिस. ठीक है. So umbilical vein से blood आता है to the left branch of portal vein. From the left branch of portal vein, the blood goes to the IVC through the ductus venosus. Now from the IVC, the blood comes to the right atrium. Right atrium से सीधे blood जाएगा left atrium में through the foramen ovale. Foramen ovale. So right atrium से left atrium में गया, left atrium से left ventricle में गया, left ventricle से aorta में गया. Aorta divides into 2 common iliacs. Common iliacs divides into an external iliac and an internal iliac. External and internal iliac. And from the internal iliac, there are 2 umbilical arteries. From the internal iliac, these are the 2 umbilical arteries. So umbilical arteries are branches of internal iliac. Now suppose अगर right atrium से blood right ventricle में जाता है, right ventricle से pulmonary trunk में जाएगा and pulmonary trunk से lungs में जाएगा, but the lungs are not functioning. So again there is a bypass channel. What is this? That's a ductus arteriosus. This is the ductus arteriosus. ठीक है. So what is this? हमने क्या देखा बच्चों? This is the fetal circulation. This is the fetal circulation. Very important. Fetal circulation. So that's the left umbilical vein. मैं इसको label करता हूँ. That's the left umbilical vein. ये ductus venosus. IVC से right atrium से foramen ovale से left atrium से the left ventricle. Aorta, common iliacs, internal iliacs. That's umbilical arteries. Suppose right atrium से right ventricle में गया. Through the pulmonary trunk, ductus arteriosus, it goes to the aorta. Now, this is the urinary bladder. ये bladder है. मतलब umbilical arteries are in the pelvis. Pelvis से जब ये umbilicus की तरफ जाते हैं, they are going on either sides of the urinary bladder. ये urinary bladder के दोनों साइड से जाते हैं. This is fetal circulation. After birth, what happens? After birth, चलो, tell me. After birth, this obliterates off. The left umbilical vein now becomes the ligamentum teres. ठीक है. So left umbilical vein का बन गया ligamentum teres. Ductus venosus का क्या बनेगा? Ligamentum venosum. हाँ, ligamentum venosum. So ductus venosus का बना ligamentum venosum. Foramen ovale क्या बना? Fossa ओवैलिस, फोरामेन ओवल का बना फोसा ओवैलिस। डक्टस आर्टेरियोसिस का क्या बनेगा? लिगामेंटम आर्टेरियोसम। डक्टस आर्टेरियोस का बना लिगामेंटम आर्टेरियोसम। Now this part will obliterate. This is the obliterated umbilical artery, and this is what we call as the medial umbilical ligament. So that's the obliterated umbilical artery जो बना medial umbilical ligament, and this non-obliterated part of umbilical artery becomes the superior vesical artery. Superior vesical artery. Understand? So umbilical artery का है ना दो parts बनता है. From the bladder to the umbilicus, this obliterates off. From the bladder to the umbilicus, it obliterates off. This is the medial umbilical ligament. This becomes a medial umbilical ligament, and this is the non-obliterated part of the umbilical artery. ये बना superior vesical artery. This forms the superior vesical artery. Fine है? Clear to all of you? So this is fetal circulation. ये याद रखना बहुत important है, fetal circulation. Okay, I'll proceed. Fine. That's the first part. Second part, third part of the duodenum. That's a bile duct. That's a pancreatic duct. This is the gallbladder. There's nothing specific in this. Chalo, identify this. Falciform ligament. ये जो ligamentum teres है ना, falciform ligament is a peritoneum, बच्चे. Falciform ligament is a fold of peritoneum extending from the umbilicus to the liver. Falciform ligament है ना, it's a fold of peritoneum which begins from the umbilicus and it goes to the liver. And the lower border of falciform ligament contains what? The lower border of falciform ligament contains the ligamentum teres. समझ में आया? तो falciform ligament is a fold of peritoneum. Falciform ligament is a fold of peritoneum which extends from the umbilicus to the liver, and the lower border of falciform ligament contains the ligamentum teres. Fine. Okay, fine. So now you tell me, what is this clinical condition? Answer. What is that clinical condition known as? ये देखो, ये pancreas है. That's an abnormal thing, and this pancreas has encircled the first part of duodenum. The first part of duodenum को encircle किया है. What is this congenital anomaly known as? The congenital anomaly is known as, any guesses? Annular pancreas. वैसे pancreas is derived from two buds, dorsal and ventral pancreatic bud. दो buds से बनता है pancreas, dorsal and ventral pancreatic bud. Normally, the ventral pancreatic bud migrates and joins the dorsal pancreatic bud. अगर ventral pancreatic bud ठीक से migrate नहीं हुआ, so that is annular pancreas. Annular pancreas occurs due to defective migration of ventral pancreatic bud. Defective migration of ventral pancreatic bud leads to annular pancreas, and एक और है pancreatic divism is due to non-fusion of the two buds. ये दो important MCQs है, याद रखना. So अगर dorsal and ventral bud fuse नहीं होते, if the dorsal and ventral bud do not fuse, it results in pancreatic divism. And defective migration of the ventral pancreatic bud, मतलब half bud आगे से जाता है, half bud पीछे से जाता है. So this is going to encircle the duodenum, and this is what we call as annular pancreas. So annular pancreas occurs due to defective migration of ventral pancreatic bud, and non-fusion of two buds results in pancreatic divism. Pancreatic divism. ठीक है? Non-fusion of two buds. Can you tell me what is this? ये क्या congenital anomaly है? What is that congenital anomaly? Any guesses? Answer this. What is that congenital anomaly? उसके पहले I'll just tell you the relations of the kidneys. बस एक थोड़ा सा बाकी है. Posterior relations of the kidneys. What is this first muscle, second muscle, third muscle? So this is 1, this is 2, and this is 3. So 1 is what? Psoas major. Second is quadratus lumborum. And third is transverse abdominis. Transverse abdominis. Psoas major, congenital, quadratus lumborum, and transverse abdominis. What is this and this? This is the medial arcuate ligament. This is the medial arcuate ligament. And what's this? Lateral arcuate ligament. Medial and lateral arcuate ligament. What is this? That's a subcostal nerve. That's the iliohypogastric nerve. And that's the ilioinguinal. So subcostal, iliohypogastric, ilioinguinal nerve. This becomes the posterior relations of the kidney. हाँ, ये बहुत ज़्यादा important है. इस पे clinical MCQs आते हैं. While approaching the kidney from the posterior aspect, all the following structures will be encountered except. Clear? While approaching the kidney from the posterior aspect. Psoas major, quadratus lumborum, transverse abdominis, medial arcuate, lateral arcuate ligament. This is the subcostal nerve, iliohypogastric, ilioinguinal nerve. ठीक है? Now just have a look at this. That was congenital polycystic kidney. Very good. Congenital polycystic kidney is right. Now secretory part of the kidney is derived from. Now these are very important MCQs. एक दो तीन बाकी है. I'm finishing now. The secretory part of the kidney is derived from metanephros. याद रखना, metanephros. So what does it form? It forms the Bowman's capsule. It forms the Bowman's capsule. It forms the PCT, loop of Henle, and DCT. So secretory part of the kidney is derived from metanephros. So metanephros से क्या बनेगा? Bowman's capsule, PCT, loop of Henle, DCT. Collecting part of the kidney is derived from ureteric bud. Ureteric bud. अब इससे क्या बनेगा? इससे बनेगा collecting ducts, collecting tubules, minor calyx, major calyx, pelvis, ureter. Understanding? मतलब collecting part separately form होता है, secretory part separately form होता है. Secretory part is derived from what? Metanephros. Collecting part is derived from ureteric bud. Both these parts have to communicate with each other. If the collecting and the secretory part do not communicate, we get small cysts in the kidney. ये देख रहे हो? So this is a congenital polycystic kidney. Congenital polycystic kidney. Failure of communication of collecting and the secretory part. Failure of communication of collecting and secretory part results in failure of communication of collecting and the secretory part results in polycystic kidney. Failure of ureteric bud to form. Failure of the ureteric bud to form. अगर ureteric bud बना ही नहीं, yeah, na ureteric bud enters the metanephros and stimulates the metanephros to form the kidney. अगर ureteric bud बना ही नहीं तो kidney नहीं बनेगा. उसे बोलते हैं renal agenesis. Are you following this? So see, collecting part is different, secretory part is different. Secretory part is derived from metanephros. Collecting part is derived from ureteric part. अब both these parts have to communicate. अगर ये communicate नहीं होता है तो polycystic kidney बनता है. If this collecting part बना ही नहीं, this collecting part will enter the metanephros and stimulate the metanephros to form the kidney. अगर ये collecting part बना ही नहीं तो kidney will not be formed. इसे बोलते हैं renal agenesis. Renal agenesis. Fine. Okay, so just remember these two things. Okay, answer this. Structures emerging from the greater sciatic foramen and re-entering through the lesser sciatic foramen. Can anyone tell me? Structures emerging from the greater sciatic foramen and re-entering through the lesser sciatic foramen. ये कौन से structures होता है? This is pin. Pin structures. P is pudendal nerve. This is internal pudendal vessels. And N is nerve 2 obturator internus. So pin structures. Pin structures will emerge through the greater sciatic foramen and will re-enter through the lesser sciatic foramen. That's a pudendal nerve, internal pudendal vessels, and the nerve 2 obturator internus. Fine. ये याद रखना बहुत important है. Fine. Now coming to this, openings in the diaphragm. बोल सकते हो openings in the diaphragm? Openings in the diaphragm. Yes, last part. 2-3 slides है और बच्चों, come on, just have some energy, put in some energy. Answer. Openings in the diaphragm. T8. T8 is IVC and the right phrenic nerve. IVC and the right phrenic nerve. T10 is esophagus with the vagus. Esophagus with right and left vagus. T12 is aorta, azygous vein, and thoracic duct. Thoracic duct. ठीक है ना? Openings in the diaphragm. Just remember, very important. Huh? Gun. What is gun? Fine. So T8 IVC and right phrenic nerve. T10 is esophagus with vagus. T12 is aorta, azygous vein, thoracic duct. Fine. Dentate or pectinate line, that's in the anal canal. याद है? That is known as watershed line. Dentate line. याद है ना वो? ऐसे ऐसे line होता है, ऐसे ऐसे line होता है. हाँ, these are the anal columns, and this line is known as the dentate line. Dentate line is a watershed line. इसके ऊपर everything is different. Blood supply, nerve supply, lymphatics. इसके नीचे everything is different. This is derived from endoderm. This is derived from ectoderm. Fine. And there is a line here जिसका नाम है white line of Hilton. That's a Hilton's line. Hilton's line represents the mucocutaneous junction. Mucocutaneous junction of anal canal. Mucocutaneous junction of anal canal. That's Hilton's line. And this line is known as the dentate line. Dentate line represents the dentate line represents the watershed line. Watershed line. ठीक है? Above the dentate line sensory नहीं है बच्चे. Below the dentate line is sensory. Above the dentate line it is supplied by autonomic nerves, that is insensitive to pain. Vicky, dentate line के ऊपर insensitive होता है, dentate line के नीचे it is supplied by somatic nerves, so it is painful. Above the dentate line it drains into the internal iliac veins. Below the dentate line above the dentate line it drains into the internal iliac lymph nodes. Below the dentate line it drains into the superficial inguinal lymph nodes. Superficial inguinal lymph nodes. ठीक है? Now fate of mesonephric duct and paramesonephric duct. हाँ, एक दो तीन ही है. There are 2-3 MCQs more. Okay, I'll just finish this. 2-3 MCQs है. Fate of mesonephric duct. चलो answer this. Mesonephric duct in males. Mesonephric duct in males. What does it form in males and females? Males में ये बनाता है the complete genital system of males. Complete genital system of males. इसमें क्या आता है? Epididymis, vas deferens, ejaculatory duct, vas deferens, seminal vesicles, ejaculatory duct, and mesoderm of prostrate. mesoderm of prostate. So mesonephric duct in male forms the epididymis, vas deferens, seminal vesicles, ejaculatory duct and mesoderm of prostate. मतलब ये पूरा genital system males का बनाता है. Females में ये क्या बनाता है? It gets degenerated in females. Mesonephric duct gets degenerated. ये बनता है Gardner's duct. Gardner's duct. ठीक है? It forms a Gardner's duct. अब चलते हैं paramesonephric duct. Just one more. Paramesonephric duct. What does it form in males? In males, it forms the appendix of testis. Appendix of testis and prostatic utricle. Prostatic utricle. In females, paramesonephric duct in females क्या बनाता है? Fundus, body, cervix, fallopian tubes, and upper 1/3 of vagina. Upper 1/3 of vagina. Can anyone tell me the lower 2/3 of vagina is derived from what? Come on, answer this, students. Lower 2/3 of the vagina is derived from anyone? Anyone? Lower 2/3 of the vagina is derived from urogenital sinus. Urogenital sinus. Upper 1/3 is derived from paramesonephric duct. Lower 2/3 is derived from the urogenital sinus. Urogenital sinus. Okay, bachcho, what is this? You tell me. This is a sacrococcygeal teratoma. Sacrococcygeal teratoma. Sacrococcygeal teratoma. And why does this occur? Sacrococcygeal teratoma occurs due to persistence of primitive streak. Persistence of primitive streak leads to sacrococcygeal teratoma. What is this? This is anencephaly. That's failure of cranial neuropore to fuse. And this is spina bifida. Failure of caudal neuropore to close. अगर cranial neuropore close नहीं होता है तो anencephaly होती है. अगर caudal neuropore close नहीं होता है तो spina bifida होता है. Spina bifida. Function of primitive streak, formation of 3 germ layers. Okay. When does the cranial neuropore close? 25th day of intrauterine life. The caudal neuropore closes by 28th day of intrauterine life. अगर caudal neuropore close नहीं हुआ तो that results in spina bifida. अगर cranial neuropore close नहीं हुआ तो anencephaly. Okay, fine. Functions of primitive streak is formation of 3 germ layers. Formation of 3 germ layers. अगर primitive streak degenerate नहीं होता है तो that results in sacrococcygeal teratoma. If the primitive streak does not disappear, it results in sacrococcygeal teratoma. Fine. Neural crest cells के derivatives बोल सकते हो? What are the derivatives of neural crest cells? Anyone? बोलो जल्दी. Adrenal medulla. Derivatives of neural crest cells. This is very important. Adrenal medulla, leptomeninges, Schwann cell, melanocytes, odontoblast. Odontoblast. What else? Facial skeleton, corneal stroma, parafollicular C cells of thyroid, parafollicular C cells of thyroid. कुछ बाकी है और derivatives of neural crest cells: adrenal medulla, not cortex, leptomeninges, odontoblast, Schwann cell, the dorsal root ganglion and the sympathetic ganglion. Dorsal root ganglion and sympathetic ganglion. फिर the skeleton of the face, the corneal stroma and the parafollicular C cells of thyroid. Parafollicular C cells of thyroid are said to be derived from neural crest cells. अगर वो option में नहीं है then it is ultimobranchial body. अगर नहीं है then you write it as ultimobranchial body. फाइन बच्चों, क्लियर है? So this completes it. This completes it. ये क्लियर है ना? This is clear. ये क्लियर है ना? This is persistence of primitive sacrococcygeal teratoma and encephaly spina bifida. Fine बच्चों, I hope these things are clear to all of you. Yes. Okay, so this is an attempt made by PW Meded team, specially for all of you students, for your INI-CET, and all the very best from the entire team of PW Meded. Do well and come for the interview. Interview के लिए ज़रूर आना. ये सब देखने के बाद make it a point to answer the grand test that is there on the PW Meded app. PW Meded app. Neural crest cells के derivatives याद रखना. तमिल मरन. Just remember the derivatives of neural crest cells. वो MCQs में आते हैं. ठीक है? ठीक है बच्चों. Thank you so much. Thank you so much for your patient listening. I hope you've understood. I have tried to complete. मतलब बहुत सारी चीजें बोल दी हैं आपको. Just go through it and come with flying colors. All the very best once again from the entire team of PW Meded. Thank you so much. Bye-bye. I'll stop you.